We're live. Do the standard procedural thing where I am going to let people know that I just went live. That's what I do. Let you guys know. Isn't that a good idea? Isn't that probably a good idea? Let's see. Live. I just let the group know. Live. Just let the group know. Div, you're first. Div, you win first today. You win first. Because you win first, Div, I'm gonna increase this light. Probably didn't do that. Let's see, can I? There we go. There. Markenzio, what's going on? Sup from Mexico. Dude. Sick. Markenzio. Good to see you, Markenzio. Mahmoud Ahmed, what's going on? Steel Titan. I've told you, bro, you gotta fucking change your name to carbon fiber hyphen TI Titan. Nasan, hi Mike. Olumide. Odumide. How's it going? Unless it's Olumide, right? But I feel like your name's probably Olumide. Cigar, what's going on, dude? Good to see you. I'm gonna let the chat. Let some other people know that we're live. Live. Let's see. Live. Give the video a like. Coming in, guys. Give the video a like. 35 of you in here. 4 likes. Give the video a like. It's probably a good idea. Osama. What's going on? Brown. What's going on? Good to see you again. Kasil. Good to see you from India. Well, Kasil, you're up late in India. It's 12:30 a.m. 12:37 a.m. in India right now. Got a lot of students in India, so I know that. Abcom98, good to see you again. Early bird for you. What time is it for you, Abcom98? Nakia, good to see you. Holy crap, Div is first, LOL. Hey, my guy. She was first. Not only was she was like zeroth because she came in before I started the live stream. Like she must have saw that I was like, there was a pending live stream. She saw that. There's a latent period where I like activate that the live stream's coming on, but I haven't started it yet. It's literally no more than like a minute, typically. Carson, what's going on? Good to see you, Carson. Hello, my exam in India. I reached India today, my exam. You're in fucking India, Carson? I would not have known that. Actually, I do know that because I know your actual name. I'm not going to say your actual name because if you go by Carson, you obviously like, I don't know, I guess you don't want people knowing your first name, but I know your first name, and I guess it would be consistent with someone who's in India. Ibrahim Khan, what's going on? Ayad, good to see you again. Yusuf, good to see you. Hey man, how you doing? Abcom, you look cooler without the bandanas. Don't know what to fucking tell you, bro. Summer, I like bandanas. I skateboard, so bandanas are very effective for absorption of perspiration. Doesn't that make sense? Sun, what up? What's going on, Sun? Brown. Okay, first we have first USMLE question here. Guys, give the video a like, come in a live stream. Give the video a like, come in a live stream. Brown, how can I incorporate your Anki cards into my prep? 6 weeks away from step 1, starting in BME 2 weeks. Your world's 75% done. When you talk about my Anki cards, you're talking about biochemistry and pharmacology. It's going to be when you finish. You say you're 6 weeks out, so you're still in UWorld. Well, I've said that after you do your QBank questions in the morning, and then you have your lunch break or whatever, and then in the afternoon, that's when you're going to do other content like my PDFs, my YouTube MCQs, etc. That's when you could work in my Anki cards. Carson, sir, many wrong on communication biostats. What do I do? Or do my exam without it? I've said that for communication / biostats. Communication ethics, you can just do my communication ethics PDF. Biostats have a PDF on that as well. But my view on communication ethics is that it's generally a waste of time to study for. The reason I have a communication ethics PDF is because people nagged me about it for ages. Back in the spring of 2021, ethics, everyone was fanatical about how the percentage of ethics on the real deal had increased. And so I obviously made a communication ethics PDF, which is excellent, but study real medicine. Okay. I wouldn't worry about communication ethics for the most part. Biostats, as I just said, I have a biostats PDF. You should know all the NBME questions for biostats. It's a very longitudinal subject. You can't just like learn biostats in 3 days and be good. It's unfortunately a type of subject, biostats, where you have to get a lot of questions wrong over time and sort of sleep on it. And then you wake up the next day and kind of like understand it better inherently. So it's a very longitudinal type of subject, which on that note, I would never save biostats. As I said, some students will like actively and purposely neglect the biostats questions, like save them. I've had students before tell me like, oh, I'm doing the whole QBank in random mode, like you said, except for biostats. I'm like, why? That's like fucking stupid. Like you need to do biostats longitudinally. So just work through questions over time. Vakya, Ravanur, 78% NBME 9 is a 250, according to Reddit score conversions, but 78% on NBME 8 is a 218. Does that sound realistic? Not sure what to believe. I would say the 78% is closer to a 250, maybe. Yeah, that's what I would say. I think I told you in the last live stream. Maybe you were the one I had said that to. Yes, use the score conversion. That's what you've done for the different form. Just take other NBMEs and see how you go percentage wise. 78% is not just a pass. Absolutely not. Ayad Ali, hey Mike, was getting 225 in all NBMEs and sudden drop NBME 28. Is it okay? You didn't just suddenly drop. I've said that it's coincidental, meaning that if, for example, you get like 220, 238, and you're like, wow, I went up. That's so amazing. Well, had you coincidentally done them the other way around, where you started with 28, went backwards, you'd think, so you can take a score drop, or you can think you shot up based on the coincidental order in which you've done the forms. You haven't actually gone down or up. It's just, as I just fucking said, it's coincidental. Abdul Rahman, I just lost where I was. Abdul Rahman, Taha was good, Michael. Not staying for long because I'm writing my step 2 tomorrow. I just wanted to thank you for all your help. Appreciate it. Well, good luck if you're still in the chat. Give the video a like. Give the live stream a like, guys. Usama CH. Hi, Mike. How much does it make a difference in match process if we have elective as compared to observership? I think it makes practically no difference. They're just gonna, I've said many times, they're just gonna look at your numbers, your scores, just your 2CK score, your class rank. They'll look at those are what get you an interview. Everything else is sort of icing on the cake, in terms of you go in there and there's other people who've got 272s and you're all kind of like in the same general location in your class. Then they're going to start looking at other things, right? But in terms of this nitpicky difference between, as you say, where was it, elective compared to observership, I mean, they don't fucking care. They're just looking at numbers. DRAL Mass, hi Mike, new lenses. Nice. They're not new. I've got lenses. I've got a shitload of like crazy lenses too. That's the thing. What's weird is that my dad's dad actually, his natural eyes were the color of these contact lenses. So like when I have these lenses in, I actually look like my dad's dad before he passed at 93. Nassan, I know this might be a cringy question, but how the fuck can I tackle research questions on the step? When I saw this, I know this might be a cringy question. I had to like read it silently, and it's like, it's not a weird question. Tackle research questions on the step. The answer is everybody's in the same ballpark as far as not knowing what those entail necessarily. So the first point is you don't have to study for them in any certain way. Okay, so that's the first point. The second point is if you encounter quote unquote mini research article question, holy shit, on your real deal, let's say a series of 3 where there's like a fucking article there and you're like, what the fuck? My advice is to flag it and come back to it, because you don't know whether you're going to have 3 minutes and you have to rush through it, or whether you have 12 minutes, you can more comfortably go through it. So you have to be able to have some self control and not get like hyped up about this and just flag it. You make a mental note of it. You're like, I'm going to have to come back to it. And you just chop through the rest of the block. And then you go back to the research question. Not text saying, "What's up, Carson? Sir, my name, Sumit Sharma." I did not know that that was your name, unless you're like being facetious right now, because I know that you operate also under a different name from that. So you have many names then. Olumide. I have 90 days left to take step. I did Amboss. Should I do UWorld? Um, you did Amboss. Should you do UWorld, since you said UWorld and Amboss are kind of the same? Should I start doing NBMEs or purchase UWorld things? Love your PDFs. 90 days until the step. And you say you've already finished UWorld. Yes, I mean, you should be doing 2 more months of QBank until about 34 days out. That's what I want. So you could just do UWorld incorrects plus my PDFs plus YouTube MCQs at this point. I don't necessarily think you have to switch over to Amboss. You could do Amboss at this point. It's fine. But another thing is, if you think your scores are good because you've already finished UWorld, you could just sit NBME 20 offline, see how you go. If you start getting 205, 210 plus on the NBMEs, I mean, you could just move your test up and sit. Braden Jackson. Hey, Mike. Good to see you, Braden. Lost where I was. Sometimes when you guys post things, the whole fucking chat moves on me. Not text saying, Sumit, from which medical college do you belong? Okay, you're like having a combo with someone else in the chat. Tag somebody next time. Use the @ so I know to avoid your question. Rebecca, how do you recommend studying for IM Shelf? For IM Shelf, what you're going to do is not only the UWorld or Amboss questions, right, which makes sense, but you're also going to do all 8 CMS forms twice. Okay, so that's 16 days. If you have a busy rotation where you can only knock out 1 form per day, 8 times 2 days, or 8 times 2 clearly. And then if you don't have a busy rotation, you can knock out 2 forms in a day. You can just get all 8 forms done twice over 8 days. So we said QBank, we said the CMS forms twice. Number 3 is going to be my PDFs, the cardiopulmonary, gastro, hematology, dermatology, and high yield mixed reviews 1, 2, 3, 4. And you're also going to do my massive YouTube playlist on IM. Okay, it's a massive fucking playlist. Mission USMLE, yo, Mikey boy, what's cooking? What's going on? Mission USMLE, SS Sjogren syndrome. Mike, what do you recommend to a person who has very weak basics, 2.5 months for step? Should he delay and go to the basics, or can he pass by focusing on your high yield PDFs and audio? If you have 2.5 months before step 1, you should be on QBank right now. So we should know based on like, are you getting 40s where you're really terrible, nowhere near passing, 50s borderline, 60s which are good, but you got to be planning on finishing QBank about a month out, and then you're going to do NBME 20, NBME's 2021. So we're going to know where you're sitting. And I've said, if you do well in the NBMEs, you just progress through them. If you're failing them catastrophically, you're going to not go on to NBME 22, and you're just going to go back to more QBank incorrects for another month, or you can proceed to another QBank like Amboss for a month. Yusuf, is it ideal to listen to your QBank while hitting the gym, or do they need deep focus? The answer is people can do both. So I don't think that while you're like running on the treadmill, you're going to be able to do my YouTube MCQs. If you're walking on the treadmill, you can do that. Some people, if you're lifting, you can listen to the questions. So I think just in general, if you're not running, you can use the clips at the gym. Okay, walking on incline, for example, you could knock out the clips, and just sitting lifting, like doing leg machines or something, or you can have it in your pocket, listening to it like a podcast form while you're doing like upper body or something. Let's see. Dania Mode, do you think a 2-year gap after graduation spent doing training research in my home country will affect matching for residency? Do you think they prefer fresh grads? They do prefer fresh grads. However, I think as long as your 2CK score is solid and you take step 3 before applying this year, that will sort of nullify, that'll cancel out the fact that you've taken 2 years out. Like it won't cancel out like 10 years out, but I think like 2 years out, like if they see a fresh step three, that means you're still trained. Like you still have your medical knowledge. They can be confident in that. Okay, I think that can that's the role of step three at this point. Ahmad Arif, I'm getting 77% URL system wise. How can I secure 260 in 5 months? Well, it's very high. 77 if you're studying for step one. I mean, you want a 260 though. So you need to be getting like mid 80s in UWorld, I would say. Well, I've said you're just going to go through QBank, just continue through it. And you got to go through my PDFs. You got to go through my YouTube MCQ playlists. You got to go through all the CMS forms. I mean, that's what I've said to do. I don't know if if you're talking about step two, then you got to go through all the CMS forms. For step one, you're not going to have the CMS forms. Obviously, just 20 through 31, including free 120. Malek, thank you for all your work. Thanks, Malek. Sumit, thank you, sir. Carson, you change your name to Sumit. Appreciate it. Nokia, starting to forget PDF content, doing random review with UWorld. Should I do PDF review in its entirety instead? You're gonna, I mean, the process of remembering, forgetting, like that's like pretty standard. Okay, so I think you've asked this already as far as like, should you just do PDFs without UWorld, without questions? And I've said like in general for most people, I don't recommend that. Like I want continuous questions as part of your prep. Like I like seeing continuous questions. That's what I prefer to see. There can be unique circumstances in which I will have a student only on PDFs, but it's more like coincidental rather than planned. In other words, let's say you come to me and you're like 5 weeks out from USMLE, or you come to me for the first time, you're like 5 weeks out from USMLE, and you might have an NBME score that's like okay, and so I know you're like maybe passing or above. But rather than wasting the other NBMEs, I could go one of two ways. I could just have you sit the NBMEs, move through, and you move your test up by like a week or something, week and a half. Like that's one possibility. The other thing I might do is rather than saying, well, you're going to do UWorld for a fucking week, which is a waste of time, I might just have you do like PDFs for a week. I could do that. That could be like one circumstance in which I have a student just go through PDFs, because I'm not going to have you do QBank for like a week. Let's see. Dralmas asked, do observerships help if I'm an IMG to lend an interview / being considered? Obviously, if you have any type of clinical experience in the US, like that can help. It's mainly the letter, I'd say, is what matters. It's letters and connections. Like, because what's going to happen is your application is going to come through and they don't care who you are as a person. It's just going to be your 2CK score. And thanks for the super chat. I'll look at that in a second. It's just going to be your 2CK score and your class rank. And then after that, they will start to consider you maybe as a person. Okay. At that point, they say, is there any research here? Like, depends on how competitive the institution is. Some places won't matter. Some specialties not going to matter. But if you're at like a competitive place, your numbers are just like what matter. They don't care who you are as a person. And then it'll just be like other things. Yes, research and letters. Okay, letters. People, if they know anyone who's written your letter. But I'd say overall overrated. That's the short point. Overrated. All right, Christopher, thanks for the super chat. I'm going to read your question now. It's a big super chat. Appreciate it. Mike, unfortunately failed step one. School let me push through third year with shelves in step two. Then schedule time after step two for a mini prep time and step one retake? Question mark. Is this doable, realistic, or gap year? Question mark. It's a confusing fucking question. Okay, so you failed step one and they're letting you, okay, so you're in, so even though you failed step one, you're on rotations. You're on third year rotations right now. And you're also, you're simultaneously prepping for step two? No. You say schedule time after step two for a mini prep time and step one retake? No. You're going to take step one before you take step two. That's what you're going to do. And if any advisor tells you to take step two before step one, he or she is low IQ. Okay. And I'm going to tell you why. It's because step one, if you do it first, it will absolutely increase your score on 2CK, which is your application. So let's say you're on rotations, you're studying hard for those, and you're like, well, I can knock out step two. I feel good. I'm going to take step two. I'm going to schedule it and I feel good. I'm prepped well for it. All my practice tests are good. And then you're going to go on and take step one after. You're going to still continue to learn stuff in your final step one prep that would have helped you on step two. Never do step two before step one. Um, I never prefer student prepping for step two or step one and step two at the same time. Like prepping for step one on rotations, it's never a good situation. It's only your school let you through. You kind of got it's like a catch 22. It's like you weren't held up, your graduation's not delayed, you're happy, that obviously that you can just move through with rotations, you're not delayed, as I said. But at the same time, now you're confronted with the annoyance of having to prep for both at the same time. So I would normally sit down and chat with you about things more specifically, like which rotation you're on and all that, and how we're going to go about that plan. Thanks, Nakia, for the super chat. Thank you. I appreciate you. CK score needed for Gen surgery, question mark, XOXO, 230 plus. I've said that Gen Surge is essentially like one rung on the ladder above IM, Peds, Obsgyn, family medicine, psych in terms of competitiveness. It's not better to do surgery. I think surgery is boring as fuck. I'm just saying that, like, in terms of competitiveness, surgery is not considered like the ultimate. You don't need like a pass to get in. You need maybe like a slight higher than pass for most places. For most places, probably. It's a little bit higher. It's because it pays more cash. That's why it's slightly more cash. So it's a little bit more competitive. More cash. It's all about the cash. It's not about what you're actually interested in. It's not that. It's about the cash. Let's see, where was I? Like prior to the super chats before I scroll down. I don't even know. Let's see here. Reem, should I do your world assessment for 2CK? The answer is I don't prescribe those generally. I've said that I only prescribe UWSAs if a student has already exhausted all the NBMEs, maybe from having taken a prior attempt on the USMLE, comes to me and says, I've used all the NBMEs already. What do I use now? Then we could entertain earlier forms. Like that's a possibility, right? But I won't incorporate UWorld self-assessments. They cause annoyance for everybody involved. Okay. Because if you do well on a UWSA, fantastic, we're happy. But if you do poorly on a UWSA, that's what fucks things up, because I say, well, look, they are actually predictive. They are, but they're not the real NBME. So occasionally, which means they're not the real USMLE, despite being predictive. So occasionally a student will do well in the NBMEs, and then they decide to fucking sit a UWSA anyway, even though I said not to do one. They fucking do it anyway. They get like a shitty score on the UWSA. Now I can't ignore it. It's like ordering a test. It's like ordering a test that you didn't need to fucking order, and now you got to follow up with it because like you're like, oh, their prolactin's like super fucking high. Why is that? Even though like you didn't need to fucking order that panel, you did. And now you just opened up a new can of worms where if a student gets a poor performance on USA 1 or 2, I'll say, well, now we can't ignore it. Now we're going to have to do like other old NBMEs to get like extra reassurance. This is anecdotal. I have many anecdotes regarding this situation where now I have to have a student for step one not only do like 1918, and then they're still like, maybe those are borderline, and they've lost confidence, and now I'm like, you're gonna do fucking NBME 3 for step one, NBME 4, NBME 5, okay? And I'll have a student literally sit like 6 more NBMEs so that they feel confident again. We've got more objective scores because their one little fucking UWSA wasn't where it should have been. That's why I don't like UWSA, but it tends to be predictive in some cases. Benoy Sandor, what up, bro? A friend came from out of town and I partied for 2 days and couldn't do questions. Can I do 120 tomorrow to make up for lost time? Exam in October? That's like a weird fucking question. That's like a very unusual question. Your exam's in October. That's ages away. I wouldn't touch 120 yet. Ali Khan, I have 6 weeks left for step 2 prep. I currently have about 3,000 questions left for UWorld. Would you recommend churning these questions out or switch to AMBA 6 week? You have 6 weeks left and 3,000 questions left for UWorld. Like, what have you been doing? Um, I mean, are you talking about you're talking about for step two, bro? You need and you have 3,000 left. You need to basically spend the next 6 weeks doing all those three. Because I've said 2 months for UWorld, which is 4,100 questions. So that means 2 weeks per thousand questions. That means you've got 6 weeks to literally finish the 3,000 questions you have remaining. Then you've got to do another 9 weeks. I'd say 8 to 9 weeks for all the CMS forms twice. Plus the NBME 6 through 14 free 120. So you have to postpone 2 months. So rather than in 6 weeks, I want you to sit in 14 to 15 weeks from now. Angela, good to see Angela. Badshah, Mike, I read your article. No. Yeah, I do want to. I can answer those questions. What I'm going to do, I'm just going to push through some more medical stuff yet. But I mean, if you stick around, I'll answer non-medical questions. I'll answer some of those non-medical questions after. It's sort of hit or miss with me. Sometimes I'll just right from the gate. I don't give a fuck. I'll answer some non-med questions, but for the moment, I'm just going to stick with the med. Don't get salty though. Don't get fucking salty, Badshah. Okay. I mean, just stick around, ask later, and then try again later, and then I might address it because I don't like answering med questions for like 2 hours, 2.5 hours. At some point, I just switch over and I don't answer med questions anymore. Jinty Gibson, what's up? How you doing, brother? Good, thanks. Ahmad Arif, I'm getting 77% UWorld system wise. How can I secure T16? I feel like I answered this question already? I feel like I did. You answered this. You asked the same fucking question. Sacred Scout, hey doc. ChatGPT says that I've likely severely disbalanced my neurotransmitters by doing 10 trips within 2 weeks. How do I recover from this ASAP? Daily, heavy gym lifting, 2 hours, of course. No trips for a while. I've told you in the last live stream, you've got to just throw out all your fucking chemicals. That's what you're going to do. All the pills you're just going to throw out. Anything that's going to cause you a trip, you're just going to throw out. It's literally not difficult. You just remove those things from your environment and that sort of takes care of itself, right? That's what you have to do. Sunny asks, confused on when to get surgery for toxic megacolon, question mark. Is it only when conservative treatment fails when you have UC? I've seen laparotomy as an answer for toxic megacolon on USMLE when patient's unstable. So they'll just say like there's a 12 centimeter cecum. Patient has a blood pressure of 80 on 40. And the answer is just choice E, laparotomy. Okay. And I mean, that's what you need to know. More conservative treatments like steroids first, decompression, NG, rectal decompression, even though like you might read these things online, I haven't seen USMLE do that. Like what they want is abdominal x-ray first, which will show gas. Okay. And then laparotomy, presumably for them being patient being unstable. And also, it's not just UC. You need to know systemic sclerosis, CREST syndrome. They can get toxic megacolon. The question I was just thinking of with the laparotomy, that's CREST syndrome. Actually, you can get 10 to 15% of patients who get intestinal involvement with CREST. Bobby Sanguine. Sir, I'm an IMG using Boards and Beyond with first aid and then doing questions on UWorld and Amboscar and 67% is a good score. Please answer, please. I mean, you're in the trolling category right now. Have you looked at any of my PDFs? Have you done my YouTube MCQs? Bobby Sanguine. I mean, obviously I get new subs and maybe you're new to my channel, but you got to do my PDFs, bro, which is the free stuff to have my website. Go through those PDFs. And you got to do my YouTube questions. This isn't just about me pushing my own shit. Let's be wildly clear here. It's because what I put out is actually the best content. Like, you have to understand that. Alvaro 37NF. Would you give up love over your dream job? Well, isn't that a romantic question? No pun intended. Dream job, please. Like what? I mean, this like notion of having like doing a job we're passionate about. I think the realistic thing is you do a job you can tolerate. Anything you do that you love, if you do it at a level where it's a lot of investment in time, it'll feel like work in some capacity, even if you quote unquote like it or enjoy it. I said that I was talking about this yesterday in the live stream. Like, let's say you're really passionate about like chess or something, and you're like, well, I'm going to spend my time. Wouldn't it be nice to do like chess as a career or something? Okay, well, apart from playing chess, you're going to have to like fucking read a lot of fucking books, which is going to feel like work. You're going to have to do like AI interface with like analyzing move combinations and permutations, which is work. It's study, because if you don't do it, other people are going to fucking do it. So, dream job, I mean, you ask about love. The reason I say it's like a there's complexity there is because I think this notion of love is also very it's like quixotic, and I'm more agnostic of the idea of it. I don't think of love as like, I think of that as like a very like youthful type, like the passiveness of that I think is very like youthful. Um I think of love as like a very like a controlled respect. I think of it as just like respect. You respect somebody. Not this like love like you're very interested, quote unquote, like an infatuation type of aspect. Let's see. Bobby's saying, when I forgot to mention I'm using UWorld and Boston system wise manner getting 60-70%. May, Rosa Mystica, good to see you again. How to increase your percentage while doing random mode? I keep getting 60 to 65% average. Um, well, I've said that as if you're going through QBank, you're trying to get your percentages up. The way you're going to do that is you're in the afternoon. So you do the questions in the morning, the 40, and then in the afternoon, that's when you're going to do the PDFs and YouTube MCQs. So as you have your afternoons transpire day to day, where you're building your knowledge from the PDFs and the YouTube MCQs, when you come back into the following days where you're doing more blocks of questions, then that's when your scores should creep up over time. Jose Guevara, what's a solid step 2 CK score? I mean, it depends on what your goals are. I think just passing is fine for a lot of, IM, PEDS, OBSGYN, psych in particular. Yeah, IM, FM, PEDS, OBSGYN, psych. You can just pass. So it depends what you want, right? Some people, they don't feel a solid 2CK score unless they're getting like a 260 plus or something, right? So everyone's different. Diego Dugarte, what's up? My girl left me in my USMLE step 1 prep. What to do? Thanks for the good content. Well, it depends if you're trying to get like a 278, which step 1 is just pass fail. So that's good news, right? But the answer is if you're in an urban area, what you're gonna do is just you're gonna go out to a station, okay, and you're just gonna open like 100, 150 plus girls within a few hours, and you'd be like, you want to go to Starbucks? No. You want to go to Starbucks? No. Let's go to this cafe. 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 Sure. And then literally within half an hour of this chick breaking up with you, you're at Starbucks having your little like your tall black coffee when she's got her frappuccino or whatever, and you're having a conversation with the new chick already. So she's going to drop you while you're doing step 1 prep. It's like, all right, half an hour later, you're in the station talking to some new chick at a cafe. Ahmed Bani, 2073. Step 3 mandatory for matching, question mark? No, of course not. 99% of people are not going to have a step 3 while they're applying. I've articulated that the utility of that is if you are a post grad and you've been out of med school at least 2-3+ years, that you can demonstrate recent competency. That's the utility of a step 3. Benoit, Sandor. Yeah, that's right, Diego. You fucking retract your question. That's right. That's right. You retract that question. What are we shy? We shy about the things we ask? Mike, you answered my question. I don't need to leave it in the chat anymore. It's like, why are we weird? Why are people weird? Let's see. Benoit Sandor. How bad is a 1-year gap between grad and match application? It doesn't matter. You graduated 2022, want to apply 2024. Our school didn't give time for USMLE prep, so I'm doing it post grad. I said it doesn't matter. Just do well in your exams. You can take step 3 if you want. Alvaro 37NF. I graduated 2020. Will apply for 2025 match. 10 publications presented at World Congress. Should I do step 3 if I get a 260 plus? And I mean, bro, it's first of all, it's not about your number of publications. I've said this. People it's about your impact. Because people who actually do research can see through a lot of this bullshit where like you may have been in a master's program where your advisor, your lab was really easy and you knocked out 24 publications, some bullshit publications, whereas another person did a fucking PhD in a lab where they may have gotten their name first on like one paper, maybe second author on another paper that has much more significant impact. So it's not about number of publications, but but people get fanatical about that. I think the utility of step 3, as I said, 2025 match, graduating 2020. Yes, that's the reason I would take step 3. Correct. If you have that much of a gap between your match application and your graduation, yes, I would sit step 3 within the year of graduation. Because if you sit step 3 now, get a score, and then you wait another like 3-4 years, that's not going to help you. Let's see. Ali Khan, our school is USMD, is forcing us to take step 2 by August 20th, 35 days. UWorld averages are around 52%. 44% completed was your recommendation. August 23rd, UWorld averages are 2%. I mean, what is this? I don't understand. Why are you sitting step 2 so close? Like, you need to finish UWorld. Then you need another 8 to 9 weeks to do the CMS forms all twice, plus all the NVMe exams. So what's happening, Ali Khan, is if you're saying that you're only 44% through UWorld and your exam is literally in a fucking month, that's not going to happen. Okay. If you sit step 2, you're severely shortchanging yourself. So 44% through UWorld, you basically need, if you rush it, you could get through by the time you're supposed to sit step 2. I'd be sitting end of October. The earliest. End of October, start of November. It seems in your case, you want to apply for the match this year. That's what you would follow up by asking. You say, oh, but I need to apply this year. I'd have to sit by like September the latest or whatever. Well, I mean, you're just shortchanging yourself. That's what's going to happen. So if you're not willing to postpone, if it's got to be you're applying this year, you got to pretty much end UWorld now, curtail UWorld now, and you got to do the CMS forms. You just got to hop straight into the NVMe content. You don't have time, bro. I don't like your situation. I hate when students are in a situation like yours because it's all just like time limited. Like, I hate when students have to get a less than ideal score just because they don't have enough time. But you want to apply this year. And that's because you didn't have better guidance sooner. But I've been harping these things for a while. So maybe you're new to my community. Maybe that's possible. Guys, give the video a like if you're coming to live streams. Subscribe to my channel if you haven't already. Not texting Mike can make an interview prep video about how to tackle the interview questions smoothly. I mean, I stay within my lane. I don't really do like general medical stuff like that. You know what I mean? I just focus more on like USMLE. Nagini, hey doc, and I'm like the last fucking person to do like an interview video that way because like I'm very unconventional. Like, you know what I'm saying, in terms of my responses. I'm not like politically correct as far as like answers you would give. Because if they're like, why do you want to do like our radiology program? I've already said, like, you're not fucking interested in radiology. You have no interest. You don't want to sit in a room without windows and look at scans all day. No, you're not interested. You know, the only reason you're interested is because, or think you're interested, is because it's about the cash, right? It's about the cash. It's lifestyle, cash. You want a specialty that's just you can just kind of knock out, tolerate, has a nice income. You're like, ooh, this is good. I can get my house. I can get my car. I can go on some vacations, right? I can have stuff. That's why you want to do radiology. You don't fucking interest in the specialty. I mean, those are the answers that I would literally like be inclined to give, which are not politically correct. Nagini, hey doc, are QBanks really important? The answer is yes. If so, which one exactly? And when to start, especially for IMG? You're going to start QBank immediately with your prep. There's no latency period. You just start QBank right away. And I've also said that when you start QBank right away, you're also going to start my PDFs, my YouTube MCQs right away. There's no latency period where you're just going to be doing like reading first before going into questions. Reem, do I need to remember the numbers, kind of details, question mark, like severe aortic stenosis numbers? The answer is yes. As I said in my PDF, you're going to do aortic valve replacement if you're under 1 centimeter squared cross-sectional area. There's a question with the surgery forms where they give 0.8 centimeters squared, and the answer is aortic valve replacement. There's a question on a new form where syncope is the answer for why a patient needs aortic valve replacement. SAD, syncope, angina, dyspnea. But the numbers, it's not. Is it dramatic? Is it that difficult to remember under 1 centimeter squared as when you need aortic valve replacement? Let's see. Lost where I was. Chayo. Hey Mike, if I'm always in the 60s in NVMe, but I do review them and related topics. Can I pass with this? Well, I've said you're going to get 3-digit score conversions from the NBME exams, aren't you? Isn't that what you're going to do? 3-digit score conversions. So you're going to go to Google Images, type in NBME, the number, score conversion Reddit, and you're going to get 205, 210 plus for step 1, 220 plus for step 2. Not tech sig, Mike. So according to you, if I get around 265, 270, step 2, CK, will my class rank matter while applying? The answer is yes, it will matter. Because in India, they ask some essay questions to write, and I come around in the mid. It will hurt you, yes. It's stupid, but this is the game that you're playing. Like, if you don't want to play the game, if you want to be unconventional, if you don't want to play the game, you can have a career like what I do. Is that what you want? Do you want to emulate me, or do you want to go into the actual, like, system of residency and stuff? So if you want to play the fucking game, you want to go to your fucking, like, dermatology residency, have your cash, right? If that's the game you want to fucking play, well, you got to get a good class rank. It's how it works. This isn't like, so that's what you got to do. And, but in your case, it's annoying because you're a good test taker. You're a perfect example of like a good test taker where in school, maybe you're more on like average side. You can do tests. And, when step 1 was numerical back in the good old days, you had an extra advantage in having 2 scores, not 1, where you could get high numbers. But you just can't have entitlement. 265 to 270 is good, but you can't have entitlement that you're going to be at, Stanford, OMG. You just got to apply broadly and see where the cards fall in that regard. Florida Flamingo. Hey, Mike, thanks for everything. Family med, shelf, anything aside from derm, MSK, ambulatory med that is high yield? Absolutely. You're going to do not just my family med, high yield family med PDF, but you're also going to do high yield risk factors PDF. Okay. Holy shit. High yield risk factors PDF is essentially a family med 2.0 PDF. Now, some students get hysterical about risk factors for step 1. I say in the preface of that PDF that it's a 2CK tilt PDF. I write that. But all those risk factors like atrial fibrillation, carotid stenosis, et cetera, diabetes, smoking, all those risk factors, a lot of that's just Family Med 2.0. So I would make sure you do that PDF. That's a big tip, doing the risk factors PDF for Family Med. Shivi I feel I have no motivation for doing Anki. Do you have any tips? Well, I've said you're only going to do Anki for your incorrects for the NBME exams. I'm not talking about the biochem farm Anki on my site. Some students ask about Anki for QBank, et cetera, which I've said don't do. You're just going to do Anki for your incorrects for the NBMEs. That's important. But if you're feeling lack of motivation, I mean, I've said go to the gym daily. That can help with your psych. And also forcing yourself to be in a physical location like the library for at least 8 hours a day is going to help. Like when I was going through 2CK UWorld, I hated it. It was so boring. The only way I could get through it is I told myself I had to be physically in the library compound for 8 hours a day. I was not allowed to leave the compound. And I'd like walk around if I had to, take breaks, look at the vending machines, doesn't matter. You're going to walk around, but you're going to be physically in the library or in a cafe for 8 hours a day to finish what you need to. Fernanda P. Which clinical master's series are the best for purchase, Mike? The most recent? Well, you can do them from our Telegram group. They're in our Telegram group, right? Why are you in our group? Or in the group files, the clinical master's. Mission USMLE. Gosh, well, it's fucking true. How many times do I have to say this? Mubashar Perza, just doing your GIT PDF, fucking amazing. It is amazing. That's an understatement, actually. Fucking amazing is an understatement for the GI PDF. Okay, if any of you guys have done that, it's like 93 pages, but it's ace. And it's really good if you're on surgery as well, that PDF. But I clearly label what's 2CK and what's for step 1. Let's see, Arwa-san, is class rank so important if my grades are not that good? I've said it's important. It matters, yes. Benoit Sandor, best way to use ChatGPT while studying if you recommend it all. I've said, number 1, don't use ChatGPT to get a correct answer. Don't like copy paste an NBME question into ChatGPT and be like, well, it says it's A, but our answer key says C. Don't do that. ChatGPT is often wrong. So what you're going to do is already know the answer. You say, I know it's C. Why though? I don't understand. And then you copy paste it in ChatGPT. You say like, why is it C? It gives you its answer. Sometimes it's wrong though, and you still say, "Are you sure? Are you sure? Are you sure?" And it's like, "Sorry, apologies for the confusion. Apologies for my last response. I actually meant the exact fucking opposite of what I just said." And but occasionally I'll give you an answer, and you say, "So this is it?" And it's like, "Yes." That's how you have to use ChatGPT. Um, Angela, what are your thoughts on a Kaplan comp exam? Because I absolutely can't stand it. Well, I mean, I've said Kaplan, the Kaplan comp exam for schools that require it, like AUA, I think SGU require. I think they might use Kaplan as well. They're going that route. The SBFCR, whatever the fuck that exam's called, AUC. So exams that are Kaplan sponsored, if you pass it, it's not necessarily indicative of whether you're going to pass step one. Okay. So we can't use that. And I think some of the schools that have, I think AUA, after you pass their Kaplan comp, you still have to go on to do like a Kaplan course or some bullshit, which makes no sense. So the purpose of the comp, meaning that you're ready to sit step one, that's been expunged essentially. So I would say it just doesn't carry meaning anymore. It gets in the way. That's all it is. So if you have a Kaplan comp at your school, we're just going to have to prep you around that. That's what's going to happen. Nikos Cerijos, for step two, focus only UWorld or Amboss as well? Question mark. No, I've said you're going to do UWorld or Amboss, and then after you finish the QBank, you're going to do 2 passes of all the CMS forms. And you're going to do NBME 6 through 14 as well as Free 120. Hussein Alio, Kenyan student. I want to start studying USMLE from scratch. Any advice? Yeah, I said you're going to start with QBank, and you're going to do that in the morning. 40 questions, untimed tutor random, 4 blocks of 10. Then the afternoon, you're going to do my PDFs from my website, the free PDFs and the free stuff tab, plus YouTube MCQ playlist. You can do the latter content is subject specific. So for example, while you're going through QBank, untimed tutor random, then in the afternoon, let's say you say, well, my cardio sucks. So you do cardio PDF, let's say 15 pages. You do like, you knock out 10 questions from the cardio YouTube playlist. So you can knock out cardio, let's say over the course of a week. You're still doing QBank untimed tutor random. The following week, you move on to Pulm or Immuno, etc. So that's one way you can go about it. Some people choose random mode for my questions as well. You know, they do the daily question, etc. You know, that's fine too. Unstable Alien asks, what do you recommend for someone who is weak in basic concepts for step one? Should they start with QBank directly or relearn the concepts again? I've said numerous times that you're going to start with QBank directly, yes, and you're just going to accept getting shitty scores. But that, once again, you're going to do the PDFs and YouTube MCQs to help increase your scores on future blocks. Sacred Scout, thanks again for being a member. And I know you're a member because you're green. Everyone else is gray. You say, okay, it's tough also for LSD and shrooms, but I'll do it. Thanks, Doc. Okay. Yeah, I said get off the substances. Mohammed Halili, hello, Michael. Love your videos. How do gap years affect matching? I've said already in this live stream that it doesn't matter if you have gap years up to maybe 1 to 2 years. After that, you're going to have obviously just higher scores. And a step three is ideal. Step three, if you're greater than 2 to 3 years post graduation, but if you're talking about like a gap year between, let's say, second and third year, I'd say more than 2-ish years, it might raise an eyebrow, but otherwise it's not going to change anything. Don't worry if you have to take 6 months off or a year off to study, or there's something with family. Don't worry about that. As long as you have high scores, that's fine. They'll take you if you get like a 261 on step two and you've had a 12 months gap unexplained. You're just like, yeah, I had 12 months off. Okay, I studied. And you had a 261 versus someone with no gap year at a 240. And some people might say, well, isn't that like, that's an unfair advantage? Like, you got to study and I didn't, and you beat me by 21 points. Like, well, let there be fucking no wild confusion that that's an extra year of like potential income in the future that was taken, right? So it's like, well, it's worth it then. You basically purchased a higher 2CK score. You were willing to make that wager, that risk. And so in turn, that's merited. That's not unfair. No one forced you to have to take a year of your life away to study. I mean, that's You deserve merit. You deserve that. Von Willebrand disease. Have you heard anything about EM getting less competitive over the past few years? I have not heard that. Also, thanks for, I would say things are only getting more competitive. That's what I would think. Also, thanks a lot for wishing my friend happy birthday. He's going to be stoked. I think his name was Ahmed, if I recall correctly. By Noy Sandor, have you had any students fail using the tetrad? What are their biggest mistakes during prep? The only students, you're asking about my personal students. My students don't fail because I make sure they don't sit unless they're ready. If I have a student who fails, okay, if that actually happens, it's not within our fucking control. It's a situation where it's like they fucking come to me and their scores are at a certain level. And then they're like, well, I have to fucking sit in 2.5 weeks or something, or I have to fucking sit in like 5 weeks. And it's like, well, there's only so much we can do. We're trying to get you up as much as we can. Okay. I mean, it's what it is. You could literally go to a fucking lecture theater with like, Golion, Conrad Fisher, the fucking, and sit in their fucking lectures daily. And in a class of like 200, you're still going to get people who fucking fail. Okay. There's still, I mean, so it's not all like lecturer dependent, but I'm just saying that I know objectively, this isn't even subjective. I know objectively based on where students' scores are on the NBMEs, whether he or she is ready. It's never a surprise for me. It's never a surprise for me. I'll be like, well, your fucking scores are not passing, or your scores are borderline. You're not ready to sit. And they're like, well, I have to fucking sit. And I'm like, well, we're YOLOing. I don't want you to sit, but we have to. Those are the situations I don't like. But if a student's doing the tetrad, okay, which is QBank, as we talked about, UWorld or Amboss, they're non-superior to each other. You could choose either one. The PDFs, go through my PDFs, go through my YouTube MSQs, that's 3. Go through all the NBME content, including CMS forms for 2CK. You do those twice. If you do all that stuff, your scores should go up optimally. Arvin Baum, hey, Michael, I'm 70% with UWorld, done NBME's 25 to 31. Why the fuck did you do NBME's 25 to 31 if you're only 70% done with UWorld? Taking CBSSA comp tomorrow, do you think 3 to 4 weeks prep would be sufficient for step 1, assuming if you pass? Then I would say you need about maybe 2 weeks to 2 to 3 weeks tops. You got to go through NBME's 20 through 31. I would go through 25 to 31 again after you pass comp. Then I would do free 120. Then I would do 20 through 24. And I would just sit step 1. Sacred Scout, do you think that a job like yours can also be done as a clinical psychologist? ? How would you do content creation if you had, let's say, a PhD in psychology instead of medicine? I think that you can do anything on the internet if you produce content. That's what you have to do. You say, how would you do content creation? The answer is you just fucking do it. You would have to, if you're talking about clinical psychology, you would literally have to you'd have to brainstorm. You'd have to say what content can I create for people? Like, what am I going to do? And you can develop a YouTube channel around, yes, any topic. If you want my personal view, I think psychologists will eventually be weeded out. I think AI is going to take that over. Why the fuck would you need some bullshit psychologist that you're paying money for when you could just use ChatGPT and ask it questions about emotions? I mean, people argue it's opinion, it's woke or whatever they want to say, but I mean, you can just fucking ask ChatGPT about relationships and it gives you pretty decent responses. It really does. But as I said, just create a YouTube channel. That's what you gotta do, and just make content. You just gotta make it. Okay. Dr. Chef, besides doing some CMS forms during rotations, what else should I do? Should I be doing before dedicated in a year for step 2? Also for academic IM, what 2CK should I be aiming for? For IM, Dr. Chef, you just need to pass 214 is what I would get. That's all you need. You just need 214. Dedicated. I mean, you said besides the CMS forms, you're asking about dedicated. Well, I said 2 passes of the CMS forms plus NBME 6014. That's what you have to do. Benoit is OBGYN. Lost the question. Fucking moved on me. Is OBGYN not a competitive specialty? I always assumed it was. I mean, the objective data is online. It's not super competitive. It's it's normal. I mean, it's mid-range. I've said, you just need to pass. You can just pass, get into OBGYN. You don't need a fucking 250. Pure Aura, is preparing for USMLE going to make us good physicians or just theoretical question solvers? Or is it how our curriculum forces us to read large textbooks going to make us good doctors? I think studying for USMLE will improve you as a doctor. Absolutely. I think doctors are worse now that step one is pass fail as opposed to before. When we actually had to study hardcore for the numerical step one, you learned more because it mattered. Like, you're going to learn a lot for step two, aren't you? Because your score fucking matters. Okay, well, it used to be like that for step one. So you get people now who don't know basic things. Um, but yes, you need to know like pharmacology. You need to know these things like as a clinician. Ali Najam, hey Mike, incorrect. UWorld revision or COS forms. What the fuck are COS forms? I think you mean CMS forms. The answer is you're gonna finish UWorld. You're gonna do first pass well as CMS forms 3 to 3.5 weeks, 6 through 8 NBMEs, double pass well as CMS forms 3 120, 9 and 10. And if your scores in NBMEs 9 and 10, Ali, are not where you want them to be, like you want a 260, but you're getting like 230, even though you could pass and just do 11 through 14, sit 2 CK, you can now take a break after NBME 10 late, go back to UWorld Incorrects for a month or AMBOSS for a month. So I don't want it to be where you do UWorld and then now you just do the UWorld Incorrects before the CMS. I don't want that, because you might find that doing 2 passes of the CMS with NBMEs 6 through 10, your scores are actually good on 9 and 10 by the time you get there, where you don't need to do the UWorld Incorrects. So only after NBME 10-ish might sometimes I have a student go back if they are willing, he or she's willing to spend that time. Usually by the time you get all the way there, you're not going to want to spend extra time. You're not going to want to do that. You're going to be burned out. You're going to be like, fuck this, I'm taking step two already. Pierre Aurora is praying for USMLE, going to make us good. I just fucking read that. Benjamin Kelser, I know you have said step one questions haven't changed much from the old forms to the new ones. Is the same true for CMS forms? The answer is yes. Going through all of them twice as you recommend. Good. Benoit Sandor, step three is also used for IMGs that need a visa. I think that's why people ask you a lot about it. Okay. But I've said that step three utility is I can help you match if you've been out of med school at least 2 years. It shows recent competency. Pure, what are the minimum marks for surgery residency in the US or an IMG? I mean, the objective data is online. Objective data is online. Like, you can literally Google like NRMP match data, and it will show you American grads, IMGs, and then it will show you like 25th percentile to 75th percentile with like bars, like candles and actual wicks, and it will show you match data from unmatched and matched. So all that data is objectively online. Badshaw. Yeah, I'm still doing my med questions, but Badshaw, you said reposting my question before. You're asking, you did a lot of volume recent post and said that some updated stance on looks. Can you elaborate on that, or have you dropped? No. I've said that. As I said, I want to keep this med focused for the moment, but I've said numerous times that women only care about looks. I've said this a lot in my live streams. I've said that women who date a male who's more plain and there's no judgment, that it's because of social circle, where she sits next to him in fucking PBL, CBL 3 times a week. They're in clinical coaching together. They work at the same office, sit next to each other. Their fucking cubicles are next to each other. It's their best friends, coworkers, friend's brother, or whatever. So there's some sort of social circle connection, and that's how most women date. Okay, and that's 99% of situations where you have an attractive female with a male who's not as attractive. No judgment. Men ask these questions a lot, so I'm simply giving a response. It's not a big deal. But when we talk about women who dating men outside social circle, for example, guy approaches her getting onto the train, guy approaches her, on a bus or something on the street, she can be open to it. It can be state. It's like getting handed a flyer. Sometimes you're like, get the fuck away from me. I don't want a flyer. I don't care who the person is. You're not looking at the person. You don't care who the person is handing you a flyer. You're just like, I don't want it. I'm not interested. And that's how a lot of it is. That's common with women and men approaching them. Men take it so personally. Sometimes a woman can be open to it. She's like, well, okay, what's your flyer? Maybe 1 out of 100 times. She's like, what's the flyer that you're trying to give me here? But I've said, if it's outside social circle, there's no connection. They only care about looks. No, they don't care about your personality. No, they don't care about your hobbies. No, they don't care about your ambitions. No, they don't care if you're intelligent. They just care about looks. That's my view. And some people might say that's not true. I care about men's personality. No, you don't. And there's some women watching us who are like, actually, he's right. I only care about looks. Let's see, William Funsho, done FA, UWorld offline, about to get a UWorld online, about to go UWorld online, take all my immunities before giving my exam. Do you think I'm on the right track? I don't know. You said you've done FA. Have you done my PDFs? Have you done my YouTube playlist, the MCQs? I mean, that's what you need to be doing. So, I mean, before you hit the NBMEs in the final month, you need to be on, you need to finish QBank with my PDFs and my YouTube MCQs. So, Nikos, which are your PDFs you recommend for step 2? All of them. I mean, all of them. Obviously, you don't have to do things like biochemistry. You don't have to do immunology. But even in the immunology playlist in the immunology PDF, you can actually do the tables on the immunodeficiencies for peds for 2CK. Okay, because they will ask those immunodeficiencies very high yield on peds in a step 1 like way. Like you'll get all these clinical questions for 2CK, but you'll literally get like a kid who has SCID, and then the answer is like adenosine deaminase deficiency, or IL-2 receptor deficiency, or hyper IgM syndrome, or it's CD40 ligand deficiency, and it's like that's on 2CK, and you're like, well, that sounds like step 1. I agree with you, but they ask the immunodeficiencies on the CK exam in a very step 1 like way. I could go into anecdotes and stories about that as well, but just that's my point on that. Let's see. Alex Parkhurst, you're just answering for him. Username A, I'm extremely exhausted by genetics, some topics, biostatistics, prepping step 1. Your comments, Mike. What? I don't know what you're asking. Yes, do my genetics PDF. Yes, do my biostatistics PDF. Isan Ora. Hello, Dr. Mike. I want to get my USMLE step 1 next year on February, and I am studying for boards and beyond videos, doing your PDFs. Any other recommendation, please? Not other. We're just going to switch up your fucking prep right now. There's no other. It's just, okay, cutting out the boards and beyond bullshit. And you're going to start doing my YouTube MCQs, and you're going to do my PDFs. Okay, and you're going to be like, LOLs, LOLs, you're right. This was actually better. After a month, you're like, I can't believe I started doing this stuff so late. LOLs. That's what's going to happen in the DMs. Zagham, let's see. Sacred Scout upgraded to silver member. Holy shit. Sacred Scout, cheers. I'm going to see your comments as I move down, Sacred Scout. Let's see. Where was I? Okay. Zagham Hassan, anyone with grad year 2011 homecoming? What is this? A fucking like, I mean, what are you doing right now? Dina, will you be releasing a micro PDF for Anki-Deck? The answer is not anytime soon. The dermatology PDF I have is loaded with micro. Okay. And I have micro, not just the micro MCQs playlist on my YouTube, but I have a micro PowerPoints that are 45 minutes. Holy shit. Some of you didn't know that. A lot of you guys didn't know that. Okay. So if you go into my YouTube playlists where you just think it's like the MCQs that I do, there's actually a PowerPoints playlist where they're literally 45-minute PowerPoint presentations. Holy shit. Okay. That I've done. Those will help you for micro. But in terms of a strict micro PDF or strict Anki cards for micro, I don't have any immediate plans to do those, only because I have no fucking interest. Okay. Rather than doing these live streams answering dumb USMLE questions in perpetuity on repetition, I could just sit in my room at the same time, work on a fucking world class micro PDF, be the best fucking resource, could get that done in like 2 weeks if I wanted to. No fucking interest. I mean, you say, well, you're answering USMLE questions. You're right. I mean, but it's also community development, isn't it? So I'm Nate. Asks, thanks for being a member. Do you think class rank is subjective? No, it's not subjective. You said we don't have a ranking system in our med school, so what's next? Well, if you don't have a ranking system, then I mean, there's nothing. That's just a data point that's missing. Then they would probably look at your like the dean's letter. That's what they would do in that case. Benoit Sandor, what's a good number of pages to do a day from your PDFs? Depends on the student. I'd say 10 to 20 pages a day. Is good for my PDFs. That's what I would recommend, 10 to 20 pages. Some students, they're so amazing that they can read like an entire PDF in a day. It's not most people. If you're scoring like 260 plus, okay, you could read a PDF in a day. If you're just trying to pass USMLE, you're getting like lower scores, it's going to take you a while to go through my PDFs. I've had students take like a week. They need like a week to go through one of my PDFs. That's fine. Angela Zavaro, thanks, Mike. I appreciate you. Can't wait for our session. Good. That's right. You did pick up a session. Or maybe multiple sessions. I'd have to check my spreadsheets. But looking forward to it too. I'm Nate. What would you prefer, a community program or a uni program? I don't think it matters. I mean, obviously, I just think it's numbers. I think a high GPA at a shitty school is superior to a low GPA at a good school, quote unquote. When I say good school, I don't mean an Ivy. I mean like if you're at like a pretty good, like a an upper mid tier institution and you're getting like B's, that's inferior to getting like A pluses at some community school. That's how it works. And then you're just gonna have your 2CK score. I mean, I don't know if you're in med school clearly. So are you talking about community program, uni program? Are you talking about residency, bro? I mean, like, so if you're talking about residency, I don't think it matters really. It's just like you choose a specialty you want, you get into the program, and you know your training. It could be good. It could be good regardless of like you think, oh, this is community, not uni, etc. You know, there's gonna be different strengths, weaknesses of different programs. A lot of it's gonna be mentor oriented. You just happen to have like a mentor who's more pedagogical, more didactic, more catering, and you might feel like you're learning more. And that defenestrates this whole community versus uni program. It literally just came down to an individual or two. Not texting Mike in India, they have set up a next. I don't know what that's referring to. If we get good rank in next, this will overshadow my. Just get a high class rank. I don't care what you do. Just you're playing the game. You got to get a high class rank. I don't know about the Indian system that way. Just do what you need to do. Get a high class rank. Sacred Scout, this chick today told me that she felt with, how's that for a transition? I'm like answering USMLE questions. And all of a sudden, this chick, okay, you're asking, this chick told me that she felt, in quotes, within 10 minutes that I was in need of love and care and that I had emotional pain in me. How do I get rid of this? This is why most chicks don't hook up. Should I just continue at my current? Um, Look, dude, it's complex because people are going to be different. Um, I think that if a female tells you that she wants a guy to cater to her and show her attention, it's the exact opposite. That can be anecdotal, but that's what I think. Okay. And people say, Mike, you're wrong. I disagree. Guys should show like, you know, some care and attention and all this. Those are positive qualities. It's not fucking true. Okay. It's the exact fucking opposite. I've talked about this before. People get triggered. Okay. I can get very blunt and I don't necessarily need to do that in this live stream, but I can get more blunt. But essentially the female inherently intuitively understands that the degree to which the male caters to her, you know, could be reflective somewhat indirectly of his exposure to other women, and that the more exposure he has to other women, which she'll see as a positive, the less he'll cater to her. So women don't want men who cater to them. It's the exact fucking opposite of what they say. You tend to be more emotional. I know that. That's also a DNA thing. You're gonna have to dial that back, or you're just gonna have to. You have to go one of both directions, one of two ways. You're either gonna have to just say you're gonna have to dial it fucking back. You know, work on your non-neediness, work on not being so effusive with women. You can really try in that direction, or you can sort of just go the other way, and you're gonna be like, I'm just gonna be an emotional fucking chick. That's how I'm going to be in my interactions, fucking vomit fucking my baggage all over chicks. And then you'll scream for a chick who like likes your baggage, or you know she likes that or something, and that could somehow work itself out, right? Not take Mike. I think that if I get around 260 270s in step 2 in applied internal medicine, I think the class rank will be overshadowed, question mark. I'm scared. Okay, I don't, why are we scared? 260 270 step 2, I mean, it will help, yeah, obviously strong scores. But depending on the institution, don't expect to apply to fucking Yale with your 270 and then have like an average class rank and think that that's going to be okay. I'll tell you why, because there's going to be other people with 270s with high class rank, and you're going to go in there and they're just going to look at your fucking numbers. Like at Ivy League schools, they're very merit based. It's about merit. That's what it is. Like it's not about who you are as a person. It's very much like about like scores. That's the culture that you're engaging in. Sacred Scout. Should I just continue at my current channel with only 10K subs or start a new one? Better to continue since plus 99% of my subs are inactive anyway. I think your channel, something happened to it. I don't know what happened to your channel, but you've got very poor engagement on it. Um, I think that yeah, it's going to be tough. It's going to be tough to not text saying why are we retracting messages? It was the most benign fucking message about 260 270 class rank, and you're retracting it. People are weird. Should I just be? You're asking about your channel, Sacred Scout. I would say um, subs don't mean anything without engagement. In fact, it can be the opposite effect. If you have a lot of subs and poor engagement, it actually hurts you. And I'd say that's the category you're in. It's tough for you to escape. You're like, I don't want to start a new channel when I have this veneer, like 10K subs. Oh my God, 10K. I hit this, like, you're not even at 10K. You're under 10K. You're like 9.5 or something, or 9.6. Not that it fucking matters, but I'm just saying that, like, I would bite the bullet and just start a new channel because your engagement's pretty poor. It's notable. Um, you got to just bite the bullet on it. Okay, we can continue talking about your channel and all that stuff, but I just want to continue with the med stream here. Ask other questions. I'll see them below. Sachi, first line treatment for heart failure? Question mark. I've said ACE inhibitor ARB. Talk about this in my PDFs. Okay, ACE inhibitor ARB, first line for heart failure. Because if you're knocking out the effects of angiotensin 2, you're going to decrease afterload, which is going to improve ejection fraction for systolic dysfunction. And you say, well, what about diastolic dysfunction? It's still the same thing. I haven't seen USMLE differentiate in terms of treatment for those. But ACE inhibitor ARB first. You still have to use your fucking head, though, because if they give you a vignette where, like, if it's a 12-line paragraph and 10 out of 12 lines are specifically about dyspnea, okay, like, you can have you can have heart failure with like one line of like shortness of breath, but the answer is still just lisinopril, like the ACE inhibitor is the first step. But if they give you like 12 lines where 10 lines are like, patient refuses to lie down in the gurney because of she says she can't breathe, there's severe dyspnea, oxygen sats are 89% on room air. So they make the whole thing about there's crackles 2/3 the way up the lung fields. Like they make the whole thing about dyspnea. The answer is going to be furosemide. Okay, so you have to be mindful if fluid unloading is required in that case. But most of the time, just ACE inhibitor ARBs first line for heart failure. Then you're going to go to the beta blocker, like bisoprolol, carvedilol, metoprolol, metoprolol extended release. Okay, then to spironolactone. But be careful. There's a new question. I think it's NBME 13 for 2CK, where spironolactone is wrong in a diabetic, can cause hyperkalemia. You don't want to give compromised renal patients with compromised renal function spironolactone. So they had thiazide as the answer, which is very fucking weird because thiazides can cause insulin resistance. Very fucking weird answer. I don't tell you. I talk about my cardio PDF. Go in my cardio PDF. I talk about it. But normally it's ACE inhibitor ARB, beta blocker, spironolactone, except for that one question I told you about. Hydralazine nitrates combination, digoxin, furosemide don't improve mortality. They're just symptoms. And then implantable defibrillators, implantable devices. Agent Fresh. Good to see you back, Agent Fresh. It's been a while. You haven't been in my live stream in a while. You're working in research. How screwed am I now? Steps taken. What are you asking, Agent Fresh? Sacred Scout. Sacred Scout. Way to take over my med stream. Just cannot be about. I don't care about your fucking app dates. Talk to me about like meeting chicks in real life. I've said neediness doesn't help in men. It never helps. Never helps. When I say that women only care about looks, that's not synonymous with like your neediness, like not factoring in. Like they can meet a guy they find attractive, and like basically the more attractive the dude, she'll be more willing to overlook his negative qualities like neediness. That's kind of what it is. Guy can be fucking cringe, top tier, fucking clingy, like needy dude. But if he's like her Tom Brady, 11 out of 10, like attractive fucking dude, she'll overlook it. And then meanwhile, confident dude, non-needy, all those qualities that men like to believe matter. But he's not her 11 out of 10 Tom Brady or whatever. No, she won't be interested. That's how it works. So I'm just saying neediness in your case, if you reduce it, then that can help facilitate your interactions forward. It's going to help reducing the non-neediness. And I've said that in order to overcome non-neediness, you have to go meet new women. Nita, are the micro PowerPoints high yield for step 2 CK? I would say that those are step 1. Quadruple 2, when are you going to put out PDF and how to get jacked? Sunny, would you recommend doing the Form 5 NBME for step 3 as additional prep for step 2? No, I would not. But I would recommend the other way around, where if you're prepping for step 3, I want you doing 6 through 14, 2CK NBMEs, and all the CMS forms. Those are going to be done for step 3, yes. But no, you're not going to do the step 3 NBME in preparation for step 2. Braden Jackson, do you get students that get upset by your honest feedback? Oh, yeah, absolutely. It's a numbers game. I mean, like, look, that's how it is in real life. You know what I'm saying? Like, if I have 30 students, you're asking people to get offended. I mean, yeah, if I have like, I'm just giving you an arbitrary number. I don't count these things. But if I have like, let's say 30 students, like maybe, I don't know, 28, 29, they're like, yeah, I'm glad you're up front. That's why I chose you as my tutor. I get that all the time. People are like, I chose you because, I think you just say it like it is. And, that's what I need. I literally get that. But then, sure, maybe 1 out of 30 or something, someone's like, you offended me or you made me feel bad or like whatever. And so over time, I've had to adapt, I've had to evolve to be like more self-deprecating. That's what I've had to like do, where I'll tell someone, I'm like, you're fucking wrong. I'm like, this is past level. Like, I'll say something like that. In the past, I would just be like, you're fucking wrong. And it would sort of just end there. And it's like, all right, that's it. I'm fucking wrong. It's like, all right, I'll see you later. Like, you're all right. See you next session. Now I'm just like, you're fucking wrong. And then I'll have to like joke. I've had to evolve to do that. Right. I'll be like, how's that for, encouragement from your tutor? Is that good? How do you feel about that? It's a good tutor, right? That's good encouragement. Your mom asked how your session went. You're like, well, he told me I was fucking wrong. Like I kind of try to make jokes. I've evolved to do that. I've had to learn to do that. My EQ constitutionally, I'd say I grew up, I'd say I had like a low EQ constitutionally, but I have like a higher acquired slash learned EQ just through making mistakes and people getting triggered and upset. Let's see, Fahad Sal for step 3, which is better, UWorld and Boss. UWorld, I've said they're non-superior to each other. You can do either one. Ishan, you're asking about like alpha. You're saying what qualities make you think that you were an alpha, and what qualifies you to think that you were lacking in the what qualities do you think you were lacking in the present? Could be better in the future. Look, I'm not. I think I've just said overall that emotions. My view is emotions are in a male are weakness. That's my view. Okay. And like you get people who are like, that's not true. Emotions and men who can express emotions, that's like a strength, or like you're trying to like cover for something, or it's like a facade, or like, no, it's not. I mean, I've evolved to just, I'm not a young fucking dude. I'm 36 and a half. That's not like that young. So, I mean, like I've evolved through experiences to just like, I see emotions as weakness. But I think there's a DNA component as well. It's like it doesn't need to be a life story about me, but it's like there are qualities like I can see in my dad's dad, like we're from New York, and it's like my dad's dad was always like kind of like stern, cutthroat, confident that way. And it's like that's just how it was. And like, I mean, I don't really know what to say. But I think it's mainly like emotional ability. I think like that's the main differentiator between like females and males. That'll trigger some people where they're like, that's not true, Michael. Like men and women are the same. It's like, no, they're not the same. But that's not a bad thing because I see emotions as like, the source of that is maternal. That's a maternal element. It's cohesion, with the family. But I think the male should be more of a rock, more of a support system, more of a support structure. Do you say qualities that you're lacking to be present more in the future? I'd say like the qualities that can make me attractive to someone are simultaneously the qualities that are quote unquote lacking. Like I can have a propensity to come off my relationships and my interactions as like very like distant or like not caring, and that can be deleterious to some interactions, but at the same time like how many anecdotes do we need, but that screens in other people where I tend to screen in like psychotic types who are like highly labile and emotional, whereas I'm just like a fucking brick wall, and then it kind of like ends there. Tushar, is that ring Cartier? It's not. This ring is I got in Tokyo, actually. Got in Tokyo. Uh, Username A, Mike. Okay, good news. Happy to hear that. Username A. Sachi, thank you. Youssef, do you think that people who score high on step two or step two CK or step one before pass fail have a high IQ, or are they just hard workers? Your performance is going to be your test taking ability times your work ethic. So if you have, let's say, an above average test taking ability, maybe by a little bit, not a lot. Let's say you have you're a bit above average for test taking, but you work really, really, really hard. That can get you a good USMLE score. It does. Testing ability matters. It's what it is. I mean, doesn't that make sense? Like, it sucks in some ways, right? But I mean, it matters. Let's see, Sacred Scout. That's what I thought. I just have to work on my 9 units. Once it's resolved, I make a huge breakthrough. Thanks, Mark D. Hey, Mike. Let's see. Hey, Mike. Aussie med student here, looking to sit step one this year. Are the competitive surgeries realistic at all? Yeah. I mean, you can absolutely match in a surgery. You don't need the highest 2CK score to match in a surgery. I talked about this already. Just get like 230 plus. I'll be in Australia end of August, actually. Be in Australia. Bubble Bubble. Hello, handsome. Shaban Jahangir. Are your PDFs for step 2 CK? Yeah, they are. 222. 2. Quadruple 2. What's the highest step 2 score one of your students? I think like maybe a 267. This isn't like a competition to be like, you haven't had a student get like a 283. You have to recognize that I take like hard cases. Like, I'd say 80% of the students I have are just fighting to pass. Okay. So if like, you have to understand that, like, if I'm like a resident at like Massachusetts General Hospital and I tutor students who are at Harvard, all of my students are going to get like 270s, 280s, right? All of my students. And I'm so amazing. Nothing to fucking do with the tutor. It's just the demographic. So 4 out of 5 of my students, I'd say, are just fighting to pass. I'm the equivalent of like the surgeon who is going to take on the hardest cases. Okay, like the quintuplet bypass and like a pneumonectomy in someone who has like history of Hodgkin's or something. Like, I'm the hard cases. I get the hardest cases, and I fight to get those cases across. That's what I do. But even surgeons, like the top surgeons, they can't save everybody. But I know the advantage I have is objectivity. It's not just a surgical results that we hope. It's like, I know, looking at the NBME scores, whether the student's passing or not. So I just don't sign off on it if a student's not passing. I talked about this earlier. I just don't sign off on it. Like, if you're not getting 205, 210 plus, on the step one equivalents, I just don't sign off on it. Sonny, I feel as though you often push the importance of getting high scores 260 plus, but that only applies to very competitive programs, but mid and low tier programs actually care about other things. No, they don't. They just care about your scores. It's laughable. This is like romanticizing. It's like, it's the USMLE equivalent of saying, like, that's not true, Michael. Women don't just care about looks. They care about your ambitions and your hobbies and your personality and all this. No, they don't. They don't care about it. It's just looks. It's the same exact thing with like numbers. It's like NFL, dude. Like, think about it like the NFL. Like, do you think they fucking care about like which school you went to or like what your hobbies are? No. They're just gonna say, how big is the fucking dude and how fast can he fucking run? How many seconds did it take him to run this? How many times can he bench this fucking weight? That's all they fucking look at. And then they care about who you are as a person. All the stuff about who you are as a person. Did he smoke weed in fucking 8th grade and he got like a misdemeanor? Like, all that stuff comes after. So none of this nonsense about like they don't care about score. Like, they care about scores first. That's all they're fucking looking at. This isn't like nihilistic. It's like, this is just, it's how it works. It's that you're asking it's the system you're dealing with. Let's see, Angela. It's okay, Mike. If you tell me wrong fucking answer, I'll laugh and just learn from it. We'll see about that. We'll see about that. Tushar, when do you plan to marry? I'm a 36-year-old dude. I mean, how personal do we have to get in this stream, right? People make assumptions though about my life all the fucking time. He'll make assumptions. You don't know jack fucking shit about someone's personal life. Gene Paul is 3 months for step one, 4 months for two. I've said that correct. I said 3 months for step one, 4 months for step two. That is correct. Sumit, good night, sir. Gene Paul. 3 months enough for most students because I see a lot of people spend more than 6 months to 1 year. It's way too long for step one prep. It should take you 2 months to get through QBank, my PDFs, my YouTube MCQs, 1 month for the NBME exams. Guys, give the video a like, coming to the live stream. Ayad Ali, happily complete 800 videos of yours today. I hope I get to finish all PDFs as well. Exam in 10 days. Thanks to the good work, Mike. Yes, sir. No questions here. Good job, Ayad Ali, getting through the 800. I mean, obviously it was 200 or so when I started making YouTube clips. So if you did the first 200 questions, they were audio. That's why it was called Audio QBank colloquially. I still have it on my site as Audio QBank. The first 200 questions are only audio on my website. If you go back, go into that tab, you can find them. That's like the real that's the litmus test for who like my quote unquote true fans are. It's like who's gone back through the old clips, the old audio questions, because those are fucking ace. Sacred Scout. I don't think that's going to bypass jack fucking shit. Okay, I don't think so. I have to read that out loud, but I mean, I don't think so. We'll go in for the poll within 5. Look, your emotional ability, I think, comes out like pretty quickly. If you want my view on it, I'm not saying that as a negative. I'm saying that as like, don't people have like it's called an EQ, right? Isn't that EQ? So like you can kind of sense someone's like emotional, like how stable they are, like to a degree, when you meet them. They don't require 10 minutes to see that really. So I would not say that that going for the poll, as you say, within 10 minutes would bypass them being able to see your emotional ability. Neediness can be picked up like pretty easily in many cases. Sing, Netek Sing. Mike, in our school, there are 4 categories: distinction, first division, second division, fail. You come in first division. Okay. So, Yale isn't going to be happy with that. But you can do other programs. It's not a problem. Not Tech Sing. If I pass my MBBS with first division consistently and I get 260, 270 in step 2 CK, will I get an interview at Mount Sinai? I think so. I think that's like good. But it depends on the specialty, right? Depends on the specialty. You can't expect to just get an interview in like plastics or something or necessarily derm even. I think, but a lot of specialties, internal medicine, absolutely. Obs-gyn, absolutely, right? Systemic E-world, how much percentage per block is okay for passing? I would say like 60s. I want to see mid 60s. Username A. Are you a man or are you a male or female? You're asking about my fragrances. I have a Dolce & Gabbana cologne. I've got some other ones on my desk here. This one, this is called Joker Trap. This one's really fucking good. This one I don't really like wear. This one I use as like an air fresh, like I spray it in my room sometimes. I've also got like a wick, like an air freshener wick system here, but this some female got this for me like way back. I just haven't really used it, but it smells fucking amazing. It smells like a clubbing, like you're going clubbing. This one, but I've got a Dolce & Gabbana in my backpack. Do you want to know about which deodorant I use too? How's that? Youssef. You say you've seen very beautiful women with below average looking guys, so there are exceptions to the rule. Dude, what the fuck did I say like a million times? Like you're saying what do you mean there's exceptions to the rule? I've literally said this like 4,000 times. that like the exception to the rule, if you see an attractive female with a not so attractive male and there's no judgment, that's right, username A, you retract your fucking messages. That's right. You retract those messages. I'm saying that if you see an attractive female with a not so attractive male and there's no judgment, 99% of the time it's within social circle. That's what I've said. Okay. It's that they know each other through the fucking class. They sit in class next to each other in PBL, CBL a lot. They see each other a lot. They're in the same office. They were introduced through her friend's fucking coworker's boyfriend's brother or whatever. They were like, there's a social circle tie, right? They're at church or something. Like there's some sort of tie there, social circle. But I've said that if you're just a random fucking dude saying hi to her on the street, where there's no social circle, she only cares about looks. She doesn't care about your fucking personality. She doesn't care about what your ambitions are. She doesn't care how smart you are. She doesn't care what your hobbies are. I've said if you're outside social circle, women only care about looks. This isn't negative. This is just like you're asking my points of view on things like that. I think that's how it works. And I've said also before that there will be women who are watching my live stream who are like, yeah, he's right, actually. I only care about looks. Let's see. Hamad Arif. I did AMBOSS self-assessment 2 days after step 1, got 227. Then I started preparing step 2, 77 UWorld systemized. Can I get too much text? Can I get 260 in 2 months dedicated? Too much like chaos in your question here. 260 2 months after you. I mean, I want to see how you do on the CMS forms. You need to be doing 2 passes of the CMS forms and all the NBME exams, and then that's going to help you. That's going to help determine where you are. I don't care about your UWorld self-assessments. I don't care about your UWorld score, your block scores. Adeli, yes, I did the old videos as well. They weren't video, they're audio, and actually liked them the most since I could hear, cut to the chase if I knew the answer. And we mastered acid-based questions because of them. That's good, dude. I'm happy to hear that, Ayad. No, it's the exact opposite, Sacred Scout, annoyingly. It's the exact opposite. Volume will help you in your case. It's what it is. It's annoying, but it's going to help you. But you just got to recognize that the landscape is that you're just going to get rejected all the time, incessantly, and you can't get down about that. You have to recognize that that's normal. You have to recognize that that's normal. I think if you get down, quote unquote, it's because you don't recognize that that's normal. And you might say, well, you're contradicting yourself, Michael, because you just, on one hand, you just said it's all about looks if I'm not in your social circle. And then you're saying, don't get down about it. What I'm saying, the amalgamation of those two statements is you have to recognize that virtually 47 out of 50 women you open, it's like someone handing them a flyer. They don't give a fuck who you are. They're like, I don't want a flyer being handed to me on the street right now. Someone's trying to hand you a flyer. You're like, I don't want it. Get away. That's how it is when women get approached most of the time. They don't care who you are. So it's not a repudiation of your looks. When you say Mike said they only care about looks, 47 out of 50 times, it's not about that. 3 out of 50 times, maybe they're open to a conversation, or 5 out of 50, whatever the fuck number you want to use. It's not about the exact numbers. I'm just making a point. It's a minority of the time that the rejection actually comes down to her deciding based on your looks. But the overwhelming majority of times you open a female, it's not about you. They will reject you and not even look at you. And you know that. You'll say hi to a girl, and then 10 minutes later, they could put you in a lineup with 6 other dudes and be like, $10,000. Who's the dude who just said hi to you 10 minutes ago? She wouldn't be able to identify. They oftentimes they don't look. They just deflect. And you're saying, well, it's not deflection. These are women I have conversations with or whatever. Well, I mean, that's what it is. I've said, it's not negative, but you have to realize that no, they don't care about your personality. You can try to cut down on your neediness, though. ZF, is it a good idea to start psychotropic meds for anxiety or dysfunctional thinking a month or 2 before the exam? Are we joking? I've said that you need to get off all meds. Students I have who are on ADHD meds, oftentimes I tell them just take your fucking meds as you need to get you through this exam. But after you're done with the steps, take 2 weeks where you just go off all medications, get like flu-like symptoms or something because you're so addicted to them. Be in bed writhing with your like flu-like symptoms because you're so addicted to your ADHD meds. It's like speed, and then maybe 2 weeks later you feel better. But um, apart from if you have like ADHD and you're literally on like Adderall or something prescription, like I would really not recommend taking any medications. Lee, what are the things you spend the most money on? Is it travel? I'm very frugal, even though people might think I'm not. I'm actually extremely frugal. I could buy a house if I wanted to. I don't want to. I have no. What do I need a 9 rooms for that I don't use? Um, but yeah, I do spend money on travel. I'm waiting for Bitcoin price to fall. That's what I'm looking for, and maybe it won't fall. Maybe it'll go higher, and then okay, I got in a little bit when it was lower, but I'm banking on it crashing later. I think we're in a bear market rally. I think that people are FOMOing in. I think that people are too bullish. I think we have another leg down, and then I'll go in heavy. That's why I'm like, I got a lot. I'm saving a lot, and if I'm wrong, wouldn't it be great to be able to time the market? Wouldn't that be great? Wouldn't it be great if we could all just know time the market? We all be fucking billionaires. Wouldn't that be fucking nice? Doesn't work like that. Maybe I missed out on putting more in when it was lower. Maybe I could put it all in right now, and I'd be richer, and I'm missing it. But I'm not going to FOMO in right now. I'm saving so that I can catch another leg down. Um, Username A, I won't retract anymore. I thought it's not a big deal. That's my first live chat. I don't give a fuck if you retract. I just pointed out that it's like people are weird. People like retract their comments, like in the Telegram group as well. I mean, I see in my admin panel people like delete their fucking comments all the time, but I see even the comments that are deleted on my end. And I'm like, why are people deleting fucking like people are like shy. People like ask a question, no one responds or something immediately, and they're like shy and they like retract it or delete it. Um, Looks in bank account. Looks fade. Some women look for substance. No, they don't. Women don't look for substance. That's not true. Maybe in social circle. That's the only time that maybe they care about personality. I'd say it's in social circle, right? Because as we just talked about, a woman, if she's attractive, will date a man who's not so attractive, and there's no judgment. But I've said 99% of the time it's social circle, like they work in the same office, or it's a friend of a boyfriend's coworker or whatever, and they were introduced. Like, and there happens to be a misalignment. There's no judgment, but that you could say is personality, because then if you're not talking about the looks, you're in social circle, it's based on personality. But I'm saying that if the male's outside the social circle, women don't give a fuck about personality. They don't care about male ambitions, hobbies, intelligence. They don't care about any of that. They just care about appearance. It's not nihilistic. People say, Mike, you're very like, it's like, this isn't negative. As I said, there's women who are watching this who are like, he's right. I only care about looks. Ahmed Bani, 2073. What's your favorite medical specialty? I don't have. I'd say family medicine is what I would have gone into had I chosen. To go into residency, family medicine, but I wouldn't say I have like a favorite. I don't like think of it that way. But family medicine, I really, really liked in med school. Nelly Patel, 1914. Is it possible to go from 60%, 70% maybe in 2 weeks? What would you recommend to make that happen? Well, that's a big jump in 2 weeks, but I would say you got to just keep reviewing the NBME exams. That's a delicate situation because it depends on how far out you are. If you're in the final month and there's no moving your exam, as an example, I would just have you push the NBME exams and hopefully your scores go up. If you just took an NBME 20, let's say, or 21, you get like around 60%, and then we could move your test if we wanted to. Could have you go back to QBank. It might entail having to go back to QBank. You say 2 weeks. I'm assuming you can't move your test, but you're going to need to move your test because 60% is a fail. The 129 man says, I get acid-based questions wrong a lot. Any tips? High-yield arrows. And as one of the other users said, you're going. I think it's Ayad Ali. You can go back through my old, my old questions below 200 audio QBank on my website. They're not on the YouTube. And you just go through those, arrow through. There's a lot of like acid base in there. Do you like either of these people? I don't know who those people are. You don't know who those people are? I don't know who those people are. The tradologist. When do you plan on to retire from medicine? Do you have any plans for early retirement? Exclamation mark. I'm thinking, no, I don't. I don't think about that right now. That's not an interest of mine. Um, I think if I had like $1 billion, I would still do this channel. Um, I would still do this channel, but I think because there's like aspects of like growth and the cliches like I joke about sometimes, but it's like it's nice having a pillar of like fulfillment. That's like one domain. Like I feel like my happiness level is increased, even if I'm not interested in medicine. I think it's boring. I've said that. That's why I don't practice, but I'm good at it. That's why I can do this. But it's like I think having like a 10% pillar 15% pillar of like fulfillment in this domain is like that I think that increases my happiness level. So like I don't have interest in like retiring right now. I would continue doing this. Have a good day, Mike. Ali, been finding it hard to recognize vascular dementia diagnosis in a question stem. Do they actually present? Don't answer if you're not answering med questions. Well, vascular dementia is easy. Yeah, like I'd say what's overrated is this notion of stepwise decline. So if I ask a student, like, how does vascular dementia present? If they happen to know, if he or she happens to know, he or she will say, oh, that's like stepwise decline. I mean, try me. It's like, what? You think they're going to say 6 months ago this happened, 3 months ago this happened? It's not really. I'll tell you how vascular dementia presents. They're going to give you a history of hypertension, and they're going to say that there's neuro or sensory abnormalities. It'll be as though the patient's had history of stroke. So we'll say like, give you a big paragraph. There's dementia. Let's say MMSE like 23 out of 30, and they'll say like blood pressure is like 145 over 95. Patients on lisinopril, and they'll say like strength in the right arm is 3 out of 5. Physical examination shows strength 3 out of 5 in the right arm, or sensory is abnormal in the left leg. And that's like the equivalent of having had a stroke, right? So there's history of infarcts. Multi-infarct dementia is another way, is another name for vascular dementia. That's how it tends to present, as per my observation on the neuroforms for NBMEs. It's not this notion of stepwise decline. That's like low yield, actually. Div, yes, looks are everything. I mean, who cares if BTSV is emotional or not, but also I'd rather date an AI versus a emotionless person. That's not true. I don't, well, now it's apples and oranges as far as like, this is my point actually. This is literally what I just said before. When a female says that she wants like a dude who's like emotional or catering to her, it's the exact fucking opposite. Like a girl who will say, oh, guys are attractive when they show emotions and stuff, is the same exact fucking chick who will like spam text some dude who's like dismissive of her. You say, Mike, like that's not true. I mean, how many triggerings do I have to like incite? People get real fucking triggered real fast in 2023. Right? I could make like contentious statements about like, like terrorist groups or like genocide somewhere, and people wouldn't blink an eye. But you make like, you make an opinion about like male female dynamics, people get real fucking umbrageous real fast. Okay. I don't know what you're asking. My experience is that if I feel tremendous emotional pain with me after giving into an addiction, that I get rejected extraordinarily more compared to when I do not feel as needy and diffuse. Okay. Can you like reword that? I'm having like issues comprehending that ESL statement. I mean, I know you're in Europe, but I know English isn't your first language either. I've said that like if you're carrying like baggage and you're feeling needy, that just universally is going to be considered less attractive. So I don't really care about the specifics on the surface, the nuances of like what it's related to. The point is it's there. ZF, is it a good idea? Okay. Let's see. I'm not going to answer that question, ZF. You have to decide whom you want to spend time with. You didn't get scolded, Div. I just said that. Like, when a female says that she's looking for a guy who's like emotional and attentive, show her attention. It's the exact opposite. And it's because anytime a guy listens to that and experiments with that and says, I'll try giving this girl attention, or it backfires. And then that's how he learns over time. Some people misconstrue what I'm saying. Some people say, "Oh, Mike has like a complex, or like he's making up for being hurt in the past." No, that's not how it works. This is called emotional maturity. When you're 15 and you're in the lunchroom and you meet boy or girl, you're like, highly emotional, infatuated, all this stuff, and then as you get older, you take on like more awareness and cortical inhibition, and like you develop a greater just as I said, awareness, conscientiousness, and perspective on like how emotions relate to interactions and stuff. And so, a guy might attempt to be more emotional or try to do those things at different points in time, only to get repeated data points where he sees that doesn't work. It's not about holding on to baggage. It's just seeing things that work. It's like if you, I don't know, you can relate it. Analogies could be anything. It's like you see certain workouts you do work better than others. Like, oh, cables work not as well as when I do like flat bench press, or, I'm doing questions and I like, I learn better when I, annotate versus don't annotate, even though I said don't annotate, but I'm making a point that there's like, you learn certain things. And, it's in my view that emotions in a male are weakness. That's my view. Okay. People don't have to agree with it. Don't have to agree with it. People have different views on things in life. That's how it works. You're going to meet people in the population who have different perspectives. That's my view. Gotham, even $1 billion this channel. That's great. If I had $1 billion, I would keep this channel. I would work on this channel still. I wish I had $1 million in my bank account just to give the whole to your channel. No, you don't. That's not true. Why are you lying to me? You're saying you wish you had $1 million in your bank just to gift the whole to your channel? No, you don't. If you had $1 million, you wouldn't gift to my channel like that. It's not true. You'd be like, oh, here's like your $50 or something, which I'd be grateful. There's no entitlement. I'd be grateful for your $50. Really appreciate it. But let's not pretend like you'd be giving me big cash. If you had $1 million, you wouldn't be giving me cash. Let's be real here. Guanasha Montilo, hey, does change in question pool for step 1 a few months back affect the score? No, it does not. Rose 23, it's a cuck question. Is boards beyond a better resource than Kaplan? I mean, these are laughable questions. You're completely misguided. Neither of those resources has a role in modern USMLE prep. This isn't fucking 2006. Okay, like you're gonna go through QBank, UWorld, or Amboss. You're gonna do my PDFs. You're gonna do my YouTube MCQs. You're gonna do the MBME exams. Path and Phys for step 1. Path is in my PDFs already. You want cardio path? Do my cardio PDF. You want renal path? Do my renal PDF. You want gastro path? Do my gastro PDF. You want hemonc path? Do my heme PDF. You want derm path? Do my derm PDF. People seem wildly fucking confused about this idea. Like they don't understand that path is like in every system. It's in every PDF I put out. And people keep nagging me about this path PDF that I haven't put out, like general histopath I haven't put out yet. Physiology is high-yield arrows. Endocrine, it's physio, high-yield arrows. Saad Masood, how to know if there is pupillary dilation in normal pupil size. Pupillary dilation USMLE tends to be 4 millimeters or greater. Obviously 1 millimeter is pinpoint, 2 millimeters borderline. I've seen 4 millimeters as like 4+ is like pupillary dilation, mydriasis. Gotham, man, you are literally God in India for the medical students who are prepping for USMLE. Is that true? I don't think so. Like I'm flattered at like the idea, but I don't think so. You say, man, you are God in India for USMLE. That's not true. How do I know that? Because you have fucking channels. There's YouTube channels with like some random Indian doctor with his stethoscope, button down shirt, and like holding up FA or something with like, 400,000 subs. With videos that are like, mediocre in my view, but the market decides. So let's not be wildly confused and pretend like I'm this quote unquote God in India for medical students. It's not fucking true. There, how many channels have blown up that are like some random Indian or like Pakistani. People be like, Mike, that's like, not, it's like, what, I'm just making observations here. We're talking about like, isn't that true though? Like, if you think about channels that are like big for USMLE, it would be like you're either in one of those countries where there happens to be like a big demographic that's like into it, or like, you're like a, 20-year-old female dancing with like your first date or something, right? Then that's like, that can blow up as well. But it's like, maybe some girls watching this are like, that's a good idea. I should try that. Let's see. Um, did you ask me the same question twice? You asked me twice about pupil size. Can you just say hi once to Indian students? LOL, it's weird, but yeah. What do you mean? Like, what do you mean? Just say hi once for Indian students? Don't I like talk about like Indians a lot? Don't I? Haven't I said that? Like I just said, like Indians make like they tend to be big for USMLE, like right, and they're also very dedicated students. It's one of those cultures where like parenting is very, very tough on them. It's a survivalist culture. So parents are very tough. I lived in an Indian homestay for 6 months when I was in fourth year med. Bet you didn't know that. It was in Australia. I lived with like an Indian mom and her kid, and super nice, super super nice. But like I'd be like in my room studying, and I would hear like he'd be doing like math questions on the computer, like outside in like the family area, and he would get like smacked, and he'd be crying and stuff. And I'm thinking like, do I need to call like Child Protective Services right now? Like I'd be like, this is fucked up. And then like I was chatting with one of my, I mean, anecdotal, I was chatting with one of my like Indian students at one point in time about this, and she was saying like, yeah, that's like normal. She's like, that's not a big deal. She's like, that comes from a place of love, because India, most populous country, is a survivalist culture where if they don't do that, then they can't rise out of like poverty. That they have to. It's a survival thing. Like if you don't do that, they just want them to fucking survive. They have to rise out, from like rise above like the population kind of thing to survive. Like that's where it originates from. But that was like the viewpoint that I received on that. But she was like, yeah, that's like normal. That's like not a big deal. And that's like more than one student who's like told me that. That's like, she's like, yeah, like I got smacked too. Yeah, my parents hit me. Yeah, that's like, I'm like, that's like not normal, but like that's normal to you. Okay, that's fine. Um, let's see, where were we? Sacred Scout. I just don't understand why emotional neediness is such a game killer. Why is it? How much are we talking about emotional neediness right now? I'm getting annoyed by emotional neediness. The discussion of it. Like, why are we focused on this one little thing, emotional neediness? You ask the same fucking question about emotional neediness like repeatedly. Why are we fixated on that? When you're asking what it does in turn, what is why is it an evolutionary tell? I don't even care why it's an evolutionary tell. Just like it doesn't. It's just like um, I've told you already. I've already kind of told you the reason neediness is seen as unattractive to women is because the more a male caters to one female, that can indirectly indicate that he has less exposure to other women, because the more exposure a male has to women, the less he's going to cater to any one woman. So she understands as a sixth sense. It's an emotional intuitive understanding that if she's getting dismissed, if she's like school is out, okay, she's dismissed, and she likes that because she knows it's because he's got fucking 8 chicks that he's talking to. And then she'll say, I don't want that. I don't like that. No, I would never be with a dude like that. But meanwhile, she'll spam text the same fucking dude who's doing that. And then some other dude who's like willing to cater to her, she'll ghost him. And some women are like, that's not true, Michael. That's like, it's fucking true. Username A, why did they change step one to pass fail? Because they're stupid. That's why. I've gone on like a 30-minute Jeremiah a diatribe about this. Okay. I mean, I've talked about this. It comes down to, it was a selfish decision. It's because you have some old white admin who are old school, and they were offended, they were upset that students weren't attending their bullshit lectures anymore. Okay, so you can sit in a room in Iceland never go to med school, do questions on UWorld and score higher than if you set foot in a classroom. Okay? So you get old white admin who reminisced for the days where people actually went to their lectures. Now people would be like, they get an attendance of like 30 people in their lectures rather than 200. They reminisce for those days where people actually cared. So by making the exam pass fail, where you now rely on the class rank for the first 2 years, it significantly increases the importance of the first 2 years of med school. You no longer have this objective test, step one numerical, to override your grades the first 2 years. So now you have only grades, and now you're like, fuck, I have to go to class and do decently in class, otherwise I'm fucked. So people go back to lecture. It was a selfish move, a disingenuous move that was designed to give power back to the med schools. It was designed to give power back to butthurt old white admin who reminisced for the days in like the 1980s, 1990s when there was just a chalkboard and like 200 people who came, 300 people who came to their like auditorium packed for their lecture, where they felt better about themselves. Whereas now they get 28 people in attendance and they're at home doing UWorld. So they reminisce for the old days and they're like, this is how we can get people back to our lectures. This is how we can do it. It was a selfish move. It decreased the quality of medical education. It decreased the quality of doctors being produced for the next generation. Because if you're forced to study numerically for an exam, you're going to do better. You guys are all going to know more for step two because it's a numerical exam, not a pass fail exam. So, it's you could say, well, now that step one is pass fail, we study extra hard for 2CK. Holy shit, which can actually be a net positive. No, because people still studied for step one or step two super hard back in the day, regardless. Your score still mattered. You still tried as hard as you could. But step one, you would learn all the weird microbiology and weird stuff that boosts your knowledge base, helps you as a future doctor that now you're just not going to focus on. So as I said, it was a selfish move. Lymph node drainage questions wrong. Do the immuno-PDF. I talk about this stuff in my immuno-PDF. What countries you visit in the near future? I'm going to the United States. I'm going to New York in early August, and then I've got family in New York, and also I'm going to go to Australia end of August, and I might consider going to some other countries in the middle of August. I'm not going to commit to that necessarily, but I'm considering going to some other countries in the middle of August. ZF, who's your style inspiration? I don't have any style. There's no style inspiration. Let's see. How long do I want it? It's almost 2 hours. I don't want to do this. It's 2 hours and 6 a.m. here. There's a lot of questions still. Let's see. I'm just going to kind of select out some questions here. Is it true that QBank is changed around end of June every year? If yes, how big of a player that is in deciding scores? The QBank? I think you're talking about the USMLE question pool. People have asked about question pool changes. I don't think that impacts your prep. They just move questions in and out. It doesn't change anything. Doesn't modify anything. No, I'm not answering that. Why you ask me cup questions like username A? What is that? No, that's not going to happen, Gotham. Why are you lying, Gotham? It's not going to happen. I'm going to give you $1 million when I get. It's like, no, you're not. If you had $1 million, you would give me 50 tops. I don't need your money. I'm just saying, let's not pretend like you are interested in giving resources like that. Migna, good to see you. Thank you for all your effort and contribution, PDF's advice. Thanks, Migna. Daniel, 5 a.m. Let's see, where lost the fucking. Where was it? 5 a.m. Why are you up? It's 6 a.m. It's not 5 a.m. here. And I don't think your comment was made an hour ago because it's pretty recent in the chat here. So it's 6 a.m., not 5 a.m. It's 6:04 a.m. So you made your comment. You must have made it 4 minutes ago. But It's not 5, it's 6 a.m. where I am. And I'll go to the gym after this, and then I'll go to bed maybe, I don't know, 10, 12, 10 a.m., 12 p.m. I get my daylight clearly in the morning, and then I wake up and it's already like dark. It'll be like, I wake up at 6 p.m. or like barely any light left. Can you make a playlist on YouTube containing arrow questions? I mean, I guess I could maybe think. I mean, endocrine is like a lot of arrow stuff. Just do endocrine. Again, do you think your PDFs inflate MMA scores? The answer is no. Where do you think UWorld and Boss get their questions from? They get them from NBMEs, and people don't complain that UWorld or Amboss inflate their scores, do they? No. It's just people trying to make excuses. If someone doesn't do my resources, doesn't do my PDFs because they're worried about them inflating their NBME scores, that's the best case scenario. I don't want that fucking person using my resources. I want that person to get lower scores and continue bitching while their friends get higher scores. That's the best case scenario. Doesn't concern me. Yusef, what do you think of dirty medicine? Look, I mean, someone actually like got salty. Someone got upset that like they thought I was like negative about dirty medicine. I'm not negative about dirty medicine. Like, why would I be negative about dirty medicine? It's like I acknowledge that you have 560 plus thousand subs. That's impressive, right? I mean, that's a big deal. You have to recognize though that with increased influence, with sub count, comes scrutiny, and it's not negative. It's just that's how it works. If you're a famous figure, politician, anyone who has influence, you have to handle more criticism. You have to handle people just voicing opinions. I'm not big. I'm small. I only have 17K subs on YouTube. That's small. That's not big, and I get criticized all the fucking time. My appearance. People think, people make comments about my appearance daily. You handle it. You got to just be strong and deflect those things. People criticize, like, they think you're like weird or something. You got to handle those things. And so if you have a high sub count, you have to be open to handling certain criticisms. And, I acknowledge that it's a big channel. But it's sort of an elephant in the room that the engagement's lower than it probably should be, right? That's not a negative. I'm not saying it as like I'm criticizing and like I'm trying to put them down. Who's this little fucking channel at 17K, me criticizing a channel that's 560? You're not in the same league in terms of subs. So I'm nobody in that case. I'm not like my opinion doesn't matter, right? But I think the engagement's low on that channel. I'm getting over 1,000 views on my videos. Every one of my videos I put out after like 2 days, 3 days. If it takes 3 days for one of my MCQs to get 1,000 views, I consider that like a bad clip at this point. There's no entitlement. There's nothing like, I don't fixate on it. It's subjectively, I like noticed maybe from like a few months ago onward, my clips started to break 1,000 for like all the ones I put out after a few days. So when you have a channel that's got like not 17K, but like 560K, 1,000 fucking subs, hugely impressive. Holy shit. It shouldn't be where a video that's been out for 2 weeks has 8K views, or a video that's been out for 3 weeks has like, 3K views. There are occasional, maybe there's videos that might be more, they might pop a bit more and you're like, oh, they got 29K. Holy shit. So the subs are actually there. They jumped, but like, I just tend to, if you're asking my opinion, nothing negative. If you're just saying like my perspective from a content creator's angle, I tend to view that. I say, why is the engagement not there? And I think it's because the consistency is not there. Okay, it's not a fucking accident. This isn't rocket science. I put out a clip every fucking day. It's like going to the gym every day. You don't want to go to the gym. You're tired, or you feel like shit. You don't want to. You think like today was an example. I didn't want to put out a clip. The opt-out clip I put out today, didn't want to put it out. I felt like shit, but I put it out. You got to be consistent. So I think it's a lack of consistency. I think there were maybe like 8 months where he or she squandered it, didn't put out content. And I think that hurt the channel. But in terms of, the market decides, I don't decide. So the market has decided that that's a big channel, and that's a good thing for that channel. Yes. Mary, Dr. Mellon, what means klutz? I haven't heard that in like, I don't think I've heard that that colloquialism in years. It does sound like it sounds like a Seinfeld word though. If I had to associate a TV show with that, I would say that Seinfeld goes with that word. Um, but I haven't heard that colloquialism in years. Mary, is that all you had to ask, Mary? Is that it? Anything else? Dr. Mom. Hi, it's Dr. Mom again. I did NBME 30, got 68%, which was 208, which my scores are 207, 205, 205, 203. I never hit 210. Exam in a week. Should I do the old free 120 or the new or both? Um, where are the other scores? I mean, I've inculcated Dr. Mom. I've inculcated that you're going to do 20 through 24 free 120, 25, 31. So you only have 5 NBMEs. Where's 20 through 24? Where are your other scores? So rather than asking about old versus new free 120, I want to know where your other NBME exams are. That's what I want to know. Also, how big is USMLE in Japan? I mean, I'm sure there's a niche for it. I've like, see, the thing is, I don't put out Japanese content. It's because my Japanese isn't at that level. Um, I don't put out Japanese content, but there's like a niche. If when I was very early, when I was like maybe, I think it was like end of February. No, no, no. It was end of March last year. End of March last year, I hit like 3,000 subs on YouTube. So yeah, it was like March, end of March last year, around that time. I hit 3,000 subs on YouTube, and I remember there was like another USMLE channel in Japan. There was like some dude who had like around the same number of subs, slightly less, and I thought about like collabing with him. I like thought about it, like I could, you know, but I don't think he spoke English, and my Japanese is like I could have convo, but like we talk about USMLE, like actual like in depth convo. It's a bit different. Say Sacred Scout, but it's to my observation that like some Japanese they view the idea of USMLE as like a fad. They think of it as like this cool thing. Like a lot of some Japanese will inquire about USMLE without actually ever taking it seriously. Like they just see it as like you're in the club of like prepping for USMLE, or like you might consider it this idea, but like they won't actually do it. And I know that because I'm an admin with another dude of a Japanese USMLE group on Facebook. That's basically a dead group. It was more like a few years ago, and it has like a few hundred in it. And I would post some like USMLE stuff in there, and it got like no engagement because the Japanese in the group, they were like, they were just there, they're like, cool, USMLE, but like none of them actually like spoke English well enough to sit the exam, and like they weren't actually, just no real, they weren't actually gonna do it. Just a fad. Uh, Kratom. The fuck is that? Sacred Scout. I don't know what that is. Madi H, AMC, or USMLE, what would you recommend? Um, USMLE. M followed by 6 9s. Hey man, your opinions on, I don't know that. What's with all these gotcha questions? Right? What's with all these gotcha questions? Do you know this? What's your opinion? I don't know what that is. Why would I know some obscure fucking like a case in law regarding Harvard? Like I don't know that. I don't know what that is. Well, P Kumar, I'm like hot. I don't have my AC on. Um, the fact that they made attendance compulsory is out of limit. The butthurt professors are angry. I mean, I talked about step going to pass fail. Those of you coming to the live stream, I gave a 10-minute Jeremiad about step one going to pass fail and how it was a disingenuous decision aimed to deliver power back to the umbrageous old white medical school professors because they were butthurt about students not attending their auditorium anymore with 200 people. They reminisced for those days, and now it's like 28 there. People sitting in an apartment in Iceland can just do QBank and get high scores. Youssef, it's a long story. I mean, how many times do I have to go back to make it do another Jeremiah ad? Youssef, how do you think AI will affect medical practice? I said that AI is going to eliminate surgery. Some student got like offended and was like, I disagree, Michael. I think that AI will like limit. I think AI will infiltrate, will be taking patient histories first, stuff like that. I'm like, I never said about first. I just said in general. I think the most significant way AI is going to impact medicine in this century is, I think, by 2100, um, humans will not be performing surgery. I think that's like a definite in Western countries, at least, by 2100. So I've made a lot of predictions like that. I think computers will merge with humans by 2100 as well. I think all these external devices, all these devices will be like laughable. Like if you see a photograph of like, you know, old like television sets where it's like a little porthole or something black and white, like you see horse and buggy, like the people sitting with their phones on the subway, on the train, everyone's looking at their phones. Those pictures will be like ludicrous later this century. I said that computers will merge with humans by 2100, and that everything we do right now is going to be internal. So everything will just be telepathic, and people aren't going to talk in 2100. You could if you wanted to, but people aren't going to talk. So every text message you send, every live stream you do, it'll just be telepathic because it'll all be in your head, which is connected to the cloud. I think that's going to happen by 2100. It might seem fast, but I think AI is going to generate that. I think AI, it'll be exponential where that's going to happen. But the question relating to medicine is that for humans that are not connected to the cloud, because it's not going to be the whole world at that point, it'll be only some. But for the humans that are not connected, I don't think that any humans will be performing surgery in like major tertiary centers in 2100. I think that the same way, like, elevators, I've talked about this. Elevators used to have conductors. You get into the elevator, there'd be a fucking dude in there with like a lever. He'd bring you up and down the floors. That's like weird now. Eventually, no one's going to be driving cars. All be self-driving. It'd be like, did you know people used to drive cars? And similarly, it'll just be when the when the robot can have a 4,000 times better error rate or lesser error rate than a fucking human, perform the surgery quicker, 50% faster, less blood loss, all this hyper fast, maybe even with just lasers. Maybe we don't even need a knife to the skin at that point. It could be like a laser that cuts without any burning, not like a cauterization laser, but somehow AI can develop that technology to the same way they use laser for the LASIK eye surgery, right? They use laser to cut the flap, and that doesn't. I mean, you could say, well, it's a burning. It's a micro. There's micro, ablation of the cells that occurs, right? But it might be all laser based. We don't fucking know. The AI is going to perfect those algorithms and develop that. It'll be recursive, improving itself at that point. But I think surgeons will be done. I think surgeons are done, and I think AI will take histories better than intakes and have diagnostic power way better than humans. I think humans will still have a role, though. Humans aren't going to go away. It'll be a situation where you will get patients who say, no, I understand, I consent, I understand that interacting with the human is going to, the outcomes might be poorer. I understand that, but I want to interact with the human. That's what they'll say. They'll say, bedside, I want the human. I don't want the AI that looks like a human. I want the actual human. And yes, I consent that my outcomes might be poorer, but that I want the human. And there will always be a role for humans. Let's see, Youssef. I just fucking read that. It's funny. I answered that question. You asked about algorithms and diagnoses. I didn't even read that, but yeah, I just said that as well. Let's see. Are there specific timings for your live, Rose? asks, I tend to do around like 3 p.m. Eastern right now. That's my timing at the moment. 4 a.m. here in Japan. That's when I start. You think I'm a fashion inspiration? I don't know. Your favorite anime is Rudra? I've said JoJo anime, but I've also, those of you in the live stream, there's those of you who've heard me say this, that I think like gaijin foreigners who are really into anime, a lot of that's like wannabe stuff. You know, you'd only know it if you live here. I've been here 7 years. I'm a permanent resident, but like you meet gaijin foreigners who are like, they try too hard. They're like, I'm going to watch anime every day. I'm going to buy all the manga, comic books. I'm going to dye my hair purple and like dress like an anime character. And like, that's cool. People, you get some people who are like really try hard. Something wrong with cultural diffusion. I'm not speaking like it's derogatory. You know, I guess try hard has a negative connotation to it. Um, but my point is like, I don't try. I'm not like a wannabe. I'm just like, and I say this because I'm a good data point. Aren't I a good data point? That like I'm like I haven't been in Japan like 2 months. Okay, been in Japan over 7 years. I'm a permanent resident of Japan, and I'm telling you that like I don't even watch fucking anime. I watched like a little bit of anime, a little bit when I like first moved here. Not as a try hard thing. It was more because I was in the Japanese immersion school at the time, and like I really sucked at listening. I found it difficult to listen to Japanese, hear Japanese sounds, and I had a buddy in like an upperclassman in the immersion school who like insisted that I watch a certain anime that was like free online, and that helped him. But I never like got into it. I watched a little bit of JoJo anime, but like I never got into like I don't like watching like cartoons. You know, like I can understand for educational purposes, but like I don't like it's not how I don't like spend my free time gaming, watching like as I said, animations, cartoons. I don't do that like in English anyway. So like I'm not gonna do that in Japanese really. Like I'm not. So um I mean that's like I could talk about that for a while, right? Sacred Scott, I've already answered that question. I've already answered that question. You're just asking it through the lens of Andrew Tate now. Holy shit. That's one way to get people real excited. Let's ask Mike about Andrew Tate, right? It's real fucking juicy stuff right there. I get asked about Andrew Tate every day, right? But you're talking about women subconsciously punishing males for lacking masculinity, not being an emotional rock. I don't think that's subconscious. I think it's conscious as well. I've said that women, if they tell you that they want a guy to show them more affection, show them more attention, it's the exact fucking opposite because what's going to happen is, I've already said this, what's going to happen is the dude will try, he'll make an effort to like help to increase communication and to be more forthright and to ask how she's doing and to maybe have a phone call or two. He'll try and he's going to observe that she doesn't want that. She'll say she wants that. She doesn't fucking want that. And someone will say, that's not true. I prefer guys who are like, who show that attention or whatever. It's fucking wrong. That's not what you think. Okay. So, I mean, this is how it works with some guys where they don't evolve to be like autist, and unemotional for a reason. It's not a negative, it's not a defense mechanism and like an immature defense mechanism. This is what I think of as like actual maturity. If you have boys when they're born, they're like dependent on their mom for like emotions. And they have a strong, there's that strong connection as they grow up. They become more and more independent until they're non-needy and they've broken free from any requirement of those emotional bonds. But I've said like, people are 15 years old in the school cafeteria and they'll be like infatuated and everything's an emotion, you're off the walls with emotion and like maybe it feels good, but it's also youthful. And as you get older, there's more cortical inhibition, not in an unhealthy way. Teenagers get speeding tickets. There's no cortical inhibition. As you get older, you say, okay, maybe it's not a good idea to speed, not just for the ticket, but for, I don't want to have to, have an injury or something. But, as you maybe encounter situations and relationships and you say, maybe it's not a good idea to be bouncing off the walls with emotion in a situation that doesn't necessarily warrant that, right? It's just you meet someone and maybe there's like a bit of an interest there, but why would it extend cortically beyond that? You just say, okay, and that it sort of just ends there. I mean, I could have a long discussion, but I'm saying, I lost where we were in the chat. Lost where we were. But you ask a lot about emotions, and you're asking about Andrew Tate in this case. But my short answer is yes, I agree. I think that women punish men who show them interest and emotion. And if they find that inconvenient, then then they should understand that it's a pay it forward, where if they don't ghost guys, if they don't lose interest in guys for showing some interest in them, right? Then those guys wouldn't evolve to be quote unquote more honest. So this isn't like a fucking accident. It's not rocket science, that I think males who have increased interaction with females, or their natural evolution is going to be toward becoming more and more cortically inhibited, will be less labile, will become stronger. That's what happens until the ultimate consummation of that. The max, it's more of like it's a maturity aspect. The male will more or less just be a rock in his interactions. I've said emotions are weakness in men. That's my view. I think emotions are weakness in men. Okay, that's my view on it. People can say that's not right, or that's like weird, or that's like, Michael, you're wrong, or you have issues, or okay, try me. You can throw your opinions at me. I mean, great, but that's my view. I'm more traditional on it. Hey, I like the way you answer questions, bold and lethal. In my opinion, you have a great confidence. Then you ask about UWorld. I'm not answering your question about UWorld right now. Mary. Edwin. Well, Edwin, I'll answer yours first because you're above. Can I prepare for step 3 in 1 month doing clinical rotations using only? I don't like that question. Too fully loaded right now. I've been in this live stream 2 hours 20 minutes. It's not a simple fucking question. The answer is you can prep for step 3 maybe in a month, yes, but the answer is only if you finished TCK recently. You say along with clinical rotations. No. The answer is you can't register for step 3 until you have graduated meds. You have to have ECFMG certification. Okay, so I don't know if you're an American student, but for IMGs, you have to pass step 1, pass step 2, pass OET, have a medical degree, get ECFMG certification, then you can register to sit step 3. You're talking about preparing for step 3 while in rotations. That doesn't work if you're an IMG. If you're an AMG, okay, but I wouldn't even recommend taking step 3 if you're an AMG because you're not going to need it. If you're an IMG, it's gonna, I would say 1 to 2 months for step 3. I'm gonna leave it at that because I don't really want to talk more about step 3 right now. I could, but I don't really feel like it. Mary Adamoa. Should I take a break every 5 minutes for? Well, I've said that. I've harped on that. I mean, I've been pretty consistent on that. That what you're going to do is when you go to the USMLE, Mary, you're going to do your first 2 blocks back to back with no break. Take 60, 90 seconds sitting at your desk without leaving the testing room. So you're just going to, you end the first block, you're going to see on the screen that the break time started. If it wasn't a crisis, the first block, if your caffeine level is good and there weren't any tragic questions in the first block, okay, everything went okay, it wasn't nothing traumatic, you're just going to take 60, 90 seconds sitting at your desk, you're like, okay, and then you're just going to go right into the second block and you're going to knock out those 2 blocks. That's very good momentum. You've already finished a quarter of the exam like that. And then after, correct, you're going to do 5 minutes, 5 minutes, 5 minutes, 5 minutes all the way through. A few sips of water, half a protein bar, half a sandwich, PBJ sandwich. And that's pretty much it. I don't want you taking an extended lunch break. The worst fucking thing you can do is take a 25-minute lunch break where you load calories. You don't want any like crash. You don't want to have to use the bathroom, induce a peristaltic maneuver because you had a load of calories all at once. You don't want that. So I'd say after the second and third blocks, half a protein bar, a few sips of water. After the fourth and fifth blocks, you can have half a PBJ sandwich and maybe just caffeinate a little bit. So tea, diet Red Bull, whatever it's going to be. And then following that, you can have no calories, but I would consume some caffeine because it's better to be 110% sharp as a whip and have atrial flutter than to be a partial crackhead. That's my view. Atheist outlaw, Earth will be ended till 2100. You mean Earth, are you saying Earth will end in 2100? No, we'll be here in 2100. Earth will be here. I mean, the relevant question is like, will humans alone still be here? The answer is yes. But as I've already said many times, computers are going to merge with humans by 2100. Okay. I mean, it depends if you come in and out of my live stream, you know? You say, Mike, you said the same thing. I heard you say it already. Okay. Well, I know the analytics and I know people come in and out. So people haven't heard me say certain things, right? But I've said all these external fucking devices. If I do an IG live in the street, if I hold up my phone in the street, I'm doing an IG live and I'm interacting with someone from Brazil, Pakistan all at once. You're see that's with my external computer. That's all going to be inside of our heads by 2100. Okay, a Neuralink, whatever it's going to be. And you say, well, that seems really soon. Well, remember, AI is going to do that. AI is going to be self-recursive. AI is going to develop the technology to do that by that time. So humans can't do that. Humans sitting in, Neuralink, humans doing all the research. No, humans at our current pace, no, we will not do that. But AI will do that. AGI will say, dude, this is easy. This is what we have to do. And so AI will be self-recursive. It's going to accelerate that type of technological growth. But I could literally, in 2100, we're all going to be telepathic. All this entire conversation is just, it's all in our heads and there will be no speaking. You're not going to need a verbal, you're not going to need to speak when you can just think your words and then it's communicated instantaneously to the other person. That's going to happen by 2100. So that's, that's my view on that. Let's see. Sacred Scout. The answer is yes to that. The general. I've said this already, the general. I talked about this in this live stream. I talked about it already. Two or three times I talked about it. You're asking how important are looks in female attraction, ? Looks versus money. I've said women only care about looks. That's what I've said. Okay. I've said women only care about looks. And I've said it numerous times already because I know there's new people in my feed in my live stream who haven't heard me say this. And they're like, Mike, what do you mean? I've said that if a female is dating a male who maybe is more plain in appearance, there's no negative judgment. It's just, it's within, so it tends to be 99% of the time, it's a social circle interaction. Okay. They know each other from the office, from class, best friends, brothers, coworker, social circle. Okay. But if she doesn't know him, if it's a guy who says hi to her on the street, on the train, there's no social circle interaction. The bar is set a lot higher. No women do not care about personality. They do not care about your hobbies. They do not care about ambitions. They often don't care about your money as well. Okay, guys, they often do not. They just care about looks. That's my view on it. And it's not negative. It's not, like people take things the wrong way. But I've said that there are women who are watching this live stream who are like, he's right, actually. I only care about looks. How many hours do you sleep? I sleep, I'm biphasic, maybe 5 to 6, so it's not enough. And then I live the day tired and caffeinated, low IQ. That's how I spend most of my day. And then I nap like before students that I have to teach. Because if I don't nap for like 20 minutes, I'm like major fucking crackhead. That's how it works. Curtis, your streams are so enjoyable. You guys enjoying the chat? You enjoying this? I don't know, Curtis. You get a lot of people who are salty with like some of the things I talk about. What do you do in your free time? I'm going to the gym after this. I'm already late. I gotta go to the gym. Um, yeah, I mean, I can answer all these med questions. You're asking about memorization. I said you just got to read. Okay, I've said that. I don't need you like Rudra. You have to just read. I've said that I don't need you making Anki cards. I don't need you annotating. I've said you got to just read and understand that remembering, forgetting is the normal oscillatory process. That's normal. Okay, you're going to be a sieve. Okay, you're going to leak information. That's normal. Okay. Okay, this is an interesting one. Sacred Scout, you say, like for example, you say you're very or emotionally reactive to a chick that strokes your hand, leg, head during the date. She then became suddenly randomly really angry and sad, like she has to punish me. I think that's all for your behavior. That's all in your head. But I think this is interesting because you and I are completely the exact opposite with that type of thing. Um, like I'm almost like I think I become like more of like a an autist slash wall with that type of thing. You say, "Oh, that's guarded. That's not healthy." No, it's not like that. I think I tend to feel zero like that. But the reason I'm articulating this to you is because that's what I've evolved to do because that's what I've learned that women prefer. Um, I tend to I notice that women tend to have more interest in an interaction when I'm more distant and dismissive, and that if they say, once again, if they say they want emotion, they say they want affection and attention, it's the exact fucking opposite. And they'll say that's not true. I prefer a guy who can like show some emotion and like that's a strength. That's like it's not fucking true. You have to understand that. Um, you don't take females' advice when it comes to dating. That's the first rule of Fight Club. Okay. Never listen to what a woman says when it comes to dating. People get real triggered. Relax. We're all just, okay, let's be partially facetious. We're all joking. Okay. Just relax. But in my view, as a male, a lot of advice you will get or input you're going to get, um, it's going to run counter to what the truth is. Okay. So the reason I'm mentioning this in the context of your little anecdote here is because you shouldn't be emotionally reactive to that type of behavior from women. You should recognize that it's uncoupled from her decision making as far as how things are going to proceed. She can quote unquote stroke your hand, legs or head, as you said. Doesn't mean jack fucking shit in terms of whether she's interested in the interaction moving forward. It's positive BSU, as I said, behavioral state untethering. So I read zero into that because I understand. I'm 36. You're like 24, I think, but I'm 36, and I understand that like a female can show what seems like affection or interest, and it doesn't mean jack fucking shit. She'll happily ghost or she'll happily like go on a few dates and then that's it. And so if the male gets emotional, that serves zero utility. You could say, well, that's protective. But I've also said simultaneously that women don't want men to be emotional. And if they say they do, it's a lie. It's not what they want. Oh, Rose, you said, I think a man showing emotions in the beginning of a relationship is a red flag. Some manipulate others by showing emotions to make the other partner feel special. You're discussing this through the lens of like manipulation. You're saying like if a man is showing you emotion, you're insinuating that. that might be to manipulate you, as if he showed you're kind of saying the opposite here. You're saying like if a man shows interest in me and I feel like he's emotional toward me, he might be manipulating me where he's pretending he's interested, but he's just going to play me, and then like we hook up or something and then he's going to drop me. And so that's a red flag. I don't want a guy who's emotional for that reason, because I don't want to get pulled in. I don't want to get played. That's the angle it's I feel like you're going at here. I'm saying it from the angle of women in general. When they say they want emotion and affection and attention from a guy, it's the opposite. Okay. And so it's there's a lot of anecdotes here. I'm not a 23-year-old fucking dude. I'm a 36 and a half-year-old guy. And so, I mean, I've had interactions. And so there's my own personal interactions, but like it's to my observation. It doesn't just have to be me, but like guy friends I've had. But if there's no shortage of dudes who will have like they'll try to finally quote unquote show some interest or attention or attraction or whatever, and because the girl might say she wants that, or they're trying to like say, well, I may have had X hookup streak and I'm going to try to be like more of I'm actually going to try to genuinely invest here a little bit. And then the girl doesn't like want that. Like she'll like, oh, actually, I just decided like we should be friends kind of thing. Like the guy's like, exactly. She didn't fucking want that. And the guy's like pissed off. And then it's like, well, no fucking shit. So I said it's a pay it forward mechanism. Like women can say they want a dude who's like emotional and catering, but then they will reject that fucking dude who was emotional and catering. And then they'll spam text some dude who's dismissive. And then they'll wonder why, like, you get guys out there like me who are like more like a wall. It's not a defense mechanism. It's not like the guy is hurt and he's compensating. It's just you get guys who learn. I'm not fucking 15. I mean, you get dudes who learn that say, no, no, no. It's because that's actually how male female dynamics work. That like women want a dude who's not into them, and they'll say they do. They'll be like, that's not true. It's like, well, it's fucking true. And then the guy just becomes an autist with fucking everybody. That's his style. I mean, I don't really know what to tell you. You're asking me about Islam. You say, why didn't you try to search and learn more about Islam? Question mark. It's the right path. Everyone knows that. I mean, I don't know if that's like a troll or something. I'm Jewish. I mean, I can learn about other religions. I've dated like when I was 23 in med school. Um, my girlfriend in Australia, she was Muslim at the time, right? I mentioned that once. I didn't want to. It got to a point though where, you know, she wanted to like get married, and it was like I was like 23, she was like 20, and she wanted like a big family and all that. Could have been great. Could have been a great life path that way. But I was just like, I kind of had to think about it in the shower and stuff, and I was like, I'm not going to convert to Islam. Um, Lost it. Solid foundation. After a few years, you want to share your problems with your partner. No, 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 not problems. You say share your problems with your partner. At least that's what I observed in the successful relationships around me. I'm Middle Eastern. Even try close community. There are many different examples of relationships. I do get your point though. Not problems. That's a key word there. Not problems. Nobody wants to hear your fucking problems. Not even like your partner. Let's not be confused. Because as a male, you have to be a rock. Problems is a very interesting word that you use there. Because even if, let's say, there's things that are personal to me, for example, I've talked about actively in my live stream, primary live streams. Like I said, I had like insecurities about appearance. That was like a big fucking thing for me growing up, and that's affected my, my thoughts as an adult. And, I've had to deal with those things. And like, but I don't view that as like, I would never spill quote unquote problems. Like I wouldn't ever like vomit fucking like, baggage onto someone. There's a difference between discussing your problems, and maybe you would say in a comment down below, you're like, well, that's not what I meant. Um, I think what you mean is just inner, more personal things that could be perceived as vulnerability. You'd want to share your vulnerabilities. I think that's what you meant to say. That's what you meant. At some point after a few years, you'd want to share your vulnerabilities. You can share your vulnerabilities earlier, I guess. That can facilitate, it's a balance from a man to a female. There's a fine balance that needs to be walked in terms of the dude's not going to be emotional about things. He's going to be a rock and solid. That's important, and non-neediness. But communication of vulnerabilities are inversely correlated. Vulnerabilities and humility inversely correlated with sexual efficacy in the male. Okay. And so, it's a balance between communication of those things can help push a relationship forward in a positive direction. But if it's like a very minute percentage of the time and not communicated in a needy way, um, that's like, people get triggered when I say these things, but I'll communicate that it's more okay for a female to sort of vomit her problems on the dude. Not that I'd want those. I don't want that. I'm just saying like that's more okay. The dude can tolerate that more than the female can tolerate that. Women punish, you know, male behavior where he's communicating general, like actual vulnerabilities, where he comes off as though he's still plagued by them, even if he doesn't think that's fair. Like I could say, like, I feel X insecure about my appearance, or, and I feel really bogged down, or I don't feel like, I just feel like I'm not confident sometimes. If I said things like that, like you could say, well, that's good, Michael. That's like vulnerable, or that's like, but that's inversely correlated with sexual efficacy. And so a man needs to understand that like he has to male behavior is more attractive when he can demonstrate that he takes ownership of his um, his issues over time, takes ownership, and can rise above them, and be able to sublimate and become stronger as a result, right? Yeah, so those communications can increase with time, but we're talking about initial courting phase. That's largely what I was referring to. Some people came into this stream probably expecting straight up med chat, but it's like we missed that boat. I was doing med chat for like 2 hours. Try. No, no, no. I'm not. I'm not cutting right now. I haven't run in maybe like 5 weeks. Maybe it's been a long time because I'm just bulking right now. I'll run more in like the fall. I'll run more in the fall. You know, when it gets colder, I'll go back to more like running. I mean, is it rocket science, atheist outlaw? You say, what do you mean by women go for looks exactly? Question mark. Please explain. Does that require fucking like uh explication? Like, I mean, what is not understood there? I've said yes, women care about looks only. That's all they care about. What's confusing about that? Well, you're talking about Andrew Tate again, Sacred Sky. You're saying that women do not care about money, but they care about how he made the money. That is no, they don't care about how you make your money. They don't give a fuck. That's laughable. No, women don't care about how you make your money. They just care about cash. That's all it is. They don't give a fuck. You think woman cares about your ambitions or like what? Women don't care about male intelligence either. That's a lie. That's a lie. Um, if a woman cares about intelligence, it's because you've already passed her quote unquote like other. She says, well, he's attractive enough or something, but no woman is going to be like, it's a lie. They're not. They don't care how you make your money. They don't care what your hobbies are. They don't care what your ambitions are. Some people say, Mike, that's real like black pill, or like that's real like, oh my god, that's like negative. It's like, how's that negative? It's like, isn't that's the truth about things though. Um, how many times are you gonna ask me about Islam? I'm just gonna block. I think I'm just gonna block you from my channel because you're spamming my. Yeah, I'm gonna block you. Hold on. Do I want to block you? Yeah, that's the fourth time you spammed it. So, okay. No, no, no. I'm not going to block you, but I don't like your method of communication, Ahmed. I don't like your communication. This is what's funny. This is the you want to know the irony? The irony is you come at me with condescension from an angle of that you're so pious and you're so on like a erudite and on a pedestal of knowledge that you're uh, talking to me about Islam, that you're acting as though I need to be reformed. You're acting as though I'm like a 16-year-old who has like problems. I'm this obstreperous 16-year-old with problems who needs to like think about life, think about his character more. You come from an angle of condescension. And the irony here is that like you don't see that. Like you think you're coming at me and that you're gonna like help me like change my perspective, but you don't see that you come from an angle of condescension and that you actually have the opposite effect. I'm not going to block you because I don't think you're malign in your intent. I think it's just lack of EQ. Sacred Sky, you said female mentions that she wants to have a family with me and also kids together and that she wants to move back to Germany with me. Does she mean it's zero? Women's words mean very little. It's their actions that matter. You could say, well, that could be extrapolated to, not just women, but men, but we're talking about dating here. Um, I think that shift is toward female as far as like women. I've said this is called BSU, Sacred Scout. I've talked to you about this behavior state untethering, meaning that her words on the surface are uncoupled from her underlying state with regard to whether she wants to move forward with you. Okay, so it can be on the spectrum of just like you meet her on the spot and it's a hookup, or it can be in terms of relationships and affection, all the way to she says she wants to have kids with you or whatever, and it's not true because it's the actions that matter. Exactly. So atheist outlaw, you saw it as well. You say Muslims have a tendency to preach their religion, no disrespect, but they also disrespect other religions. I disagree. I agree with your statement in that he's coming off as though he's from an angle of condescension, as though he's pious. But I disagree with your statement as far as you're saying Muslims. That's overgeneralized. It's not all. That's not a healthy statement. I don't agree with that aspect. And you probably are like, yeah, you're right. That's not what I meant. I know that's not what you meant. What you mean to say is maybe some people of certain religions, not necessarily just Muslims, any religion. You could say some people of some religions. You say this, Mike, you're fucking sounding like a politician, or I'm not preaching right now. I'm being serious. Some people have a tendency to maybe, um, discuss their views from an angle of condescension unintentionally. That just happened to be that one individual. I don't think it has anything to do with his religion. To be, can I be a mod? The answer is no. I've never even fucking seen you in my chat. Literally the first time I've seen you in my entire in this chat in my entire life, and you want to be a mod? That's laughable. It's laughable. I'm just gonna delete you, block, because you're spamming. Gone. That's laugh. Point of view on the Kardashians. What are we in ninth grade? Are we in ninth grade? The percentage of my focus that's ever been on that is 0%. Like I've never even once thought about that, nor would I ever care. Lotus flower. Damn, how did you stay so calm with Ahmed? Question mark. I go off on people who do this. Please let me know how you stay calm and still communicate effectively. I mean, that's as I already said, Rose. That had nothing to do with religion. Zero to do with religion. Zero. Could have been anyone. Could have been, you know, I could preach. If I want to be a condescending asshole, I could preach and be like, "Well, I'm Jewish, and uh, these are the views that you should like take on or whatever." I mean, like it has nothing to do with religion. It was just an individual who, acted as though another individual needed to be reformed. I mean, I just Lotus Flower. It's I don't really. That's how I am in general with communication. It's not like with Ahmed specifically. Like I'm sort of, you know, I just observed it for what it was. And there's why would I? Why would you're asking? How did you stay so calm? Why would I get emotional over that? Do you see what I'm? I hope that proves a point right now that I was making before. Why would I get emotional over that, guys? It's um, it's nearly 7 a.m. here. I gotta go to the gym. I gotta like eat something. I'm gonna have a protein shake. I'm gonna go to the gym. Then I'm gonna come back and I'm gonna eat chicken salad. That's what I gotta do. Maybe get to bed by like I don't know, 11 a.m. or something. Or I really don't know. Nakia, my guy is still alive. Let this man go to the gym. XOXOLOL. He's not emotional. Sacred good to see you guys as members. Look at you guys, green members together. Yeah, I know BSU. I wonder who came up with the abbreviation. Yeah, I wonder. Yeah. Um, okay, guys. As I just said, I'm gonna head to the gym. That's what I do. I'm gonna do an Instagram live. Actually, I'm gonna go out in the street. That's what I do. I'm gonna do an Instagram live out in the street. That's what I do. All right, guys. So give the video a like. Give the live stream a like. All right. Obviously, I'll be on tomorrow more than likely. All right, guys. Give the video a like.